Okay, thank you. Hello, everyone. Good evening, all of you. I guess I'm live now. Let me confirm if I'm live. I will start the session ahead. Let me confirm. Just give me 1 minute. Okay, I guess it's working. Yes, it's working. Yes. So everything is good to go? The video, audio, the slides you can see? Okay. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today we all are gathered here to discuss the pharmacology important questions. So here I will be discussing important previous year questions which are frequently asked in the competitive exam from the pharmacology. So basically, if you know my way of teaching, I will not be discussing PYQ, only the question. I will be discussing that complete topic. So if any question asked from that topic, you will be able to solve that. So in the next 3-4 hours, we are going to discuss nearly 40 to 50 topics of pharmacology. So it will be a highly useful session for you because you will get important topics of entire pharmacology in the next 3-4 hours. If you have already read pharmacology, it will be useful in brushing up your concepts, in revising. And if you have not read pharmacology, then also it will be very useful for you that at least you are covering the important topic of the entire pharmacology in a crisp manner, in a concise manner, in the most easiest manner. Believe me. So can we start without wasting any further time? Okay, so I will be discussing the topics in the form of the question. So basically, I will show you a question. First, we will guess the answer of that question. And then whatever the question is from that topic, we will discuss that topic completely so that if other questions are asked from that topic, you will be able to solve that. So in this way, we are going to cover many important questions and topic of pharmacology, which are important for competitive exams. Specifically for FMG, NEET PG, and ICT. The topics are same. So let's start it without wasting any time. The first question is in front of you. So I have covered the various topics now, the various questions, taking in consideration of all important systems and general pharmacology also. So first few questions are from general pharmacology. So we will see important topics from that. And then one by one, system wise, the kidney, the heart, the CNS, ANS, one by one, we will take the important systems and questions from that. Okay, so in this way, we will have a broad overview of the pharma in the next 3 years. Okay, so let's start it. Can I start? You got the overview what we are going to do. Okay, so the first question is in front of you. Pharmacodynamics deals with what? The basic question. It's very easy question. Basic question. Pharmacodynamics deals with what? The 4 options are in front of you. It is the effect of drug on the body, or is it effect of body on the drug? Or is it absorption of drug? Or is it metabolism of the drug? What do you mean by pharmacodynamics? Can you guess? Can you guess the answer? First you guess the answer from ABCD. At max you will be wrong. It's okay, but at least you can guess now. Then we will see complete topic, the pharmacokinetics and dynamics. I will give you an overview. Yes, the answer is correct. It's a very easy question. The correct answer is A, and you all are right. Absolutely right. Okay, now see, let me explain you in pharmacology. What is pharmacology? I'm teaching you pharma na today. What is pharmacology? It is the study of drugs. Pharmacology is study of drugs. Okay, in pharmacology, we are having 2 branches, the pharmacodynamics, PD, and pharmacokinetics, PK. What do you mean by PK and PD? Acha. Pharmacology is the study of drugs, na? I told you. Why we take drugs? By drugs, I mean the medicine, not that drugs. Okay, so why we take drugs? Because we have certain disease in our body or in our patient's body. So we are taking the drug. For example, I'm having migraine. I'm having headache today. I'm just giving you an example. I'm having headache because of migraine. So I want to treat it. So I will take a drug which is effective for migraine. So just suppose I'm taking by oral route. So I will take the drug by mouth. Okay, I will drink the water. I will take the drug by mouth. The tablet will go inside my stomach and intestine. It will get absorbed. So first we are taking the drug, for example, by oral route. For any disease we are taking. Okay, so the drug will go inside the mouth. Okay, then it will go in the esophagus. Okay, then it will go in stomach and intestine. Now there is the rule. There are 2 types of drugs, acidic drug and basic drug. There is a rule, acidic drugs absorb from acidic medium and basic drugs absorb from basic medium. So same medium is required for absorption. If the drug is acidic, it is absorbed from acidic medium. And if the drug is basic, it is absorbed from basic medium. Okay, there are 2 types of drugs. Okay, I will give you a list which drugs are acidic, which are basic from the main drugs. Okay, now we know stomach have acidic pH. We all know that. And intestine have basic alkaline pH. So acidic drugs are absorbed from stomach and basic drugs are absorbed from intestine. I guess everyone knows it. Now, this session will be very crisp, very concise. Each and every line which I am saying, it's an MCQ. So please concentrate. Okay. So acidic drugs are absorbed from the stomach and basic drugs are absorbed from the intestine. Got it? So please learn that the first thing. Acidic drugs absorbed from acidic medium. The basic drugs are absorbed from basic medium. Now, whatever is the drug, is it acidic or basic? Ultimately, it got absorbed. What do you mean by absorption? Absorption is transfer of drug. Transfer of drug from what to what? Transfer of drug from the site of administration to blood. To blood, that is circulation. From administration to circulation, that is, this transfer is known as absorption. So ultimately the drug get absorbed, means it reaches in the blood. It reaches in the blood. Now, once it is in the blood, there are multiple organs in our body. Where does it will go? Blood is flowing everywhere from head to toe. Where does the drug will go? The drug will go only in that organ which is having receptors of that organ. Say yes. So I am assuming if I am having headache, the drug I am taking for that drug should have, the brain should have, the brain parenchyma or the blood vessels of the brain should have the receptor for that drug. Then only that drug will enter inside the brain, whatever. Just suppose I am having diarrhea. So I am taking a drug to treat my diarrhea. So the intestine should have receptors for that drug. You got my point? So just suppose I am having tachycardia or bradycardia or heart failure. So I am taking a drug for that. So the heart should have receptors for that drug. So from the blood, the drug will enter to its site of action. The site of action is different. If I am having headache, the site of action is brain. If I am having diarrhea, the site of action is my intestine. If I am having heart failure, the site of action is the heart. Like that. Okay. So this is known as distribution. The drug get distributed. This is known as distribution in the body. So distribution is the movement of the drug from the blood to the organs. Hana? First we have done the transfer of the drug, the movement of the drug from administration to the blood. This is absorption. And from the blood to the organs, this is distribution. So first step is absorption, then distribution. Now, once the drug is inside this organ, we are supposed it should treat my headache, it should treat my diarrhea, it should treat my... So drug should show its mechanism of action and treat that disease. That's why we are giving the drug. That's why we are giving the drug. Okay, I'm assuming the drug is treating my disease, showing its mechanism of action. Now, what next? What's next? We cannot keep the drug forever in the body. No, the job is done. Its job is done. Now I want to excrete it. What is the route of excretion? 90% or more than 90% of drugs are excreted in urine, not feces. They are excreted in urine. So the drug should come back in the blood, and from the blood it should go in the kidney, and via kidney it should excrete it out of the body via urine. I am assuming that, but there is a problem. The last step is excretion, but excretion cannot happen directly. You will say, ma'am, what is the problem in excretion? Let's excrete it. Now, what is the problem? The problem is that urine is water. It's liquid. It's water. So only polar drugs will be excreted. Polar matlab water soluble. Polar matlab water soluble drug. You got my point? Polar matlab water. So only polar or water soluble drugs can be excreted. But the problem is that many drugs are non-polar. So they cannot be excreted in urine. So before they go in the urine, they should go in the liver. In the liver, the non-polar drug get converted into polar. Liver have the enzymes. These enzymes convert non-polar drug to polar drug. Okay. And then again the polar drug will come in blood, and from blood it will go to the kidney. So in the liver, the conversion of non-polar to polar, this is known as metabolism. This is known as metabolism of biotransformation. One and the same thing. Metabolism and finally there is excretion. So basically, I am having headache. Hana, example. Okay. Now I am taking a tablet for that. I am taking a drug. I want to treat it. Okay. So I am taking it by mouth. So first thing, the drug will absorb. Number one. From the site of administration, it will go in the blood. It will get absorbed. Now from where it will be absorbed? From stomach or intestine? If it is acidic, it will be absorbed from stomach. If it is basic, it will be absorbed from intestine. But ultimately it will reach in the blood. Say yes. Ultimately it will reach in the blood. From the blood, it will go to the site of action. Currently the site of action is brain if I'm having the headache. So this is distribution. So first step is absorption. Okay. That is movement from the administration to the blood. Second step is distribution. That is from blood to the site of action. The third, it will go in the liver and get converted from non-polar to polar so that it can be excreted out. The third step is metabolism. Metabolism is conversion from non-polar to polar. It takes place in liver. And finally, it gets excreted out of the body via kidney. So there are four things the body is doing on the drug. What are the four things the body and what the body is doing on the drug? It is known as pharmacokinetics. So pharmacokinetics have four things. What are the four things included in the pharmacokinetics? First, the drug get absorbed. Absorption means movement from administration to blood. Then it get distributed. That is movement from blood to various organs, the site of action. Then biotransformation or metabolism, that is in liver, non-polar get converted to polar. And finally, it get excreted in the urine via kidney. Say yes. So these are the 4 things happening in a sequence. Give me a thumbs up. Come on. Say yes. Okay. Now, drug is doing only one thing inside the body. This is the 4 things body is doing on the drug. Hana, my body is absorbing the drug. Then it is distributing the drug. Then it is converting non-polar to polar, that is metabolizing the drug. And finally, it is excreting the drug. So my body is doing 4 things on the drug. But what drug is doing? This is what body does on the drug. That is PK. But what drug is doing on my body? Only one thing, the mechanism of action. For what is purpose we are taking the drug? The mechanism of action is known as pharmacodynamic. So mechanism of action, this is pharmacodynamic. And the remaining 4 things are pharmacokinetics. You got my point? So what is pharmacodynamic? The mechanism of action of the drug. On the site of action, it is pharmacodynamic. So what the drug do the body is pharmacodynamic. But what the body do to the drug, okay, that is absorption, distribution, metabolism and excretion. This is pharmacokinetic. So my point is that we are having 2 branches, pharmacokinetic, pharmacodynamic. I guess everyone got it. This is what the body does on drug. Okay. And this is what drug does on body. How to learn that? Drug does on body. So D for D, learn. PD is for drug. What the drug is doing on the body. Here there are 4 things in that. Here only one thing. So what are the 4 things here? Absorption, distribution, metabolism and excretion. They happen in a sequence. Got it? But PD, only one thing. Mechanism of action. Say yes. Got it? So this is the basic. Now have a look on your question and answer. Everyone answer now. Everyone. So what I'm asking for PD. PD don't have any further things. Only one thing is there in PD, pharmacodynamics. What is that? It is effect of drug on body or effect of body on drug. So D for D, PD, it is effect of drug on the body. And if I change the same question, instead of pharmacodynamics, if I ask pharmacokinetics, the answer will become B in that case. So you are prepared for that? Let me show you a few more questions based on that. Okay. So read the question and tell me the answer. Quick. On the same concept, we are having another question. Pharmacokinetics includes study of all except. What is not included in pharmacokinetics? There are 4 things in pharmacokinetics. Absorption is there. Yes, it's there. Distribution is there. Yes, it's there. Excretion is there. It's there. But adverse effects is not included. So we are having 4 things here. Absorption, distribution, metabolism or biotransformation, one and the same thing, and excretion. Hana, adverse effect is not included here. So my answer is C and you all are right. So these are the simple questions. One more question. Pharmacodynamics includes what? What is pharmacodynamic? Pharmacodynamic means PD. It is having only one thing. Is it elimination? Is it excretion? Is it absorption or is it mechanism of action? The 4 things are in PK, but in PD we are having only one thing, mechanism of action, and you people are right. So the correct answer here is D. Only one thing is included. Okay, now coming on the next topic. Okay, the one topic is completed. Coming on the next topic. Okay, in this way we are going to complete the topics. Are you understanding the session? Are you enjoying learning? Is it a good way to understand the topics? The next question is in front of you. So many times you get question on the pH of the drug. So we will understand this concept completely now. What is the best way to manage a patient present with aspirin poisoning? There is a patient. You are a doctor. Now there is a patient in your clinic. The patient have taken 100 tablets of aspirin together. 100 tablets. And the patient is having aspirin poisoning. The patient is dying in front of you. You want to save your patient. What you will do? Will you make the urine acidic or will you make the urine alkaline? Or will you treat it with an acetylcysteine? This is done in paracetamol poisoning, not in aspirin poisoning. Or will you do gastric lavage? What do you do? In case of aspirin is Disprin. You know, many times the person want to do the suicide. You know, if the person wanted, they take the overdose of the drug. So if just suppose there is a person who is taking 100 tablets of aspirin together, the patient is in poisoning. You want to save. Being a doctor, you want to save. Okay. Before coming on the answer, yes, you all are right. The correct answer is B. Now let me explain you. You get many questions on this concept. This concept is little bit tricky, but not difficult. So please understand. Is the speed is good? You are finding it, a high speed, or is it average? Good for you? Is it good? Shall I continue with the same speed? I'm little bit on the higher side so that I can cover more and more topic in less time. I'm having limited time of 3 years. I want to cover maximum topics in that. I guess you are understanding my excitement. Okay. Anyways. Okay. So let me tell you, listen. Let me ask you a question. One question in front of you. Listen, everyone. You are taking a drug. You are a doctor. Of course you are. You are giving a drug to a patient. You are giving a drug to your patient. What do you want? The drug should be absorbed or excreted? The drug should be absorbed more or excreted more? What do you want? What do you want? Answer in the comment. Please understand my question first. You are giving a drug by mouth, by oral route to your patient. There is a patient in front of you and you are giving a drug to your patient. What do you want? The drug should be absorbed more or excreted more? What do you want? Huh? What you are expecting? What do you want? First answer, you answer, then I will tell you the answer. Yes? So many students will say, yes, absorption more. No, no, no. There are two different scenarios. Listen, there is a diseased patient in front of you. So in that case, you want the absorption more. Yes, you want the drug should be absorbed. It should reach the blood. It should go to the site of action and shows its mechanism of action so that patient can be treated. Patient can be cured. But imagine a reverse scenario. The patient is not having a disease. The patient is in poisoning. Our question, the patient have taken the drug in overdose. Now in this scenario, what do you want? The patient is a case of poisoning. The patient have taken the overdose of the drug. You want still absorption more or this time you want excretion more? In case of poisoning, you want excretion more. You don't want absorption. You want to stop absorption. Because patient have already overdose of the drug. Already absorption is more. Now we do not want more absorption. We want excretion more. So it depends from scenario to scenario. Sometimes we want absorption more. Sometimes we want excretion more. You are getting my point. Now listen, learn two rules. Learn two rules. Tell me the organ of absorption and tell me the organ of excretion. Tell me the organ of absorption. The organ of absorptions are two. The drug can be absorbed in the stomach, can be absorbed in the intestine. There are two organs, stomach followed by intestine. They are back to back. Stomach followed by intestine. There are two organs of absorption. For absorption, same pH is required. Acidic drugs are absorbed from acidic medium, that is stomach. And basic drugs are absorbed from basic medium, that is intestine. I guess I told you this concept. But excretion organ is same. It's kidney. Only one organ is there. Acidic drugs are also excreted from the kidney. Basic drugs are also excreted from the kidney via urine. So organ of excretion is one. Organ of absorption are two. But organ of excretion is one. That is via urine. Hai But we can change the pH of the urine. Hai For excretion, opposite pH is required. Acidic drugs are excreted in basic urine. And basic drugs are excreted in acidic urine. Kitno ko samajh mein aaya? Give me a thumbs up. How many of you got it? Give me a thumbs up. What I said? For absorption, same medium is required. And for excretion, opposite medium is required. There are two types of drugs. Acidic drugs, basic drugs. Here also I am having two types of drugs. Acidic and basic. And here also I am having two types of drug. Acidic and basic. You got my point? So if I want the absorption of acidic drug, I have to give acidic medium. If I want to do the absorption of basic drug, I have to give basic medium. For absorption, same medium is required. Acidic in acidic, basic in basic. Got my point? That is acidic drugs are absorbed in stomach because stomach have acidic medium and basics are absorbed in intestine because intestine have basic medium. For excretion, opposite medium is required. Organ is same, it's kidney. But acidic drugs are excreted in basic urine and basic are excreted in acidic urine. So that is the pH of the urine we are changing. Here also urine, here also urine. I hope you all are getting. Say yes if you got it. Got it. Now imagine there is a patient in front of me. I want to treat the patient. The patient is not poisoning. Here the patient is having a disease. So I want absorption more so that patient can be cured. So for acidic drug, I will, it will be absorbed in acidic, basic. And if there is a patient of poisoning, here you don't want absorption. Here you want ki drug excrete ho jaye body se jaldi so that you can save your patient. In case of poisoning, you want excretion more. So if the patient have taken overdose of some acidic drug, like the current patient, the patient has taken aspirin, 100 tablets of aspirin. Aspirin is an acidic drug. So you want to make the urine basic so that it get excreted and you can save the patient. And if the patient have taken too much of some basic drug, so in that case, you want to acidify the urine. So your next question should be, ma'am, can we change the pH of urine by our choice? Yes, we can do so. You got my point? I will tell you how we can do so. You got the concept. This is the master diagram in which I will explain you all the concepts here in pharmacokinetics and dynamics. So first understand, for absorption, same pH is required. And for excretion, opposite pH is required. I guess everyone got it. So acidic drugs are absorbed in acidic pH, that is stomach. And basic drugs are absorbed in basic pH, that is intestine. You got it. But for excretion, both of them are excreted from kidney. Both of them are excreted in urine. But urine pH is opposite. Okay. Acidic drugs are excreted in basic urine. And basic drugs are excreted in acidic urine. Now, one more very important concept I want to give you here. I told you there are two types of drugs, acidic and basic. Acidic drug is the acid. All acid have proton. Like HCl, it is H and Cl. Like HNO3, it is H and NO3. So H is common in all acid. है ना? So whenever it goes in the body, it gets split like this. H positive, A negative. Like H positive and Cl negative. All the bases have OH. NaOH, KOH. है ना? Just for your understanding. So it split like this. है ना? So both the drug, whether the acidic drug or basic drug, they have two form. Please understand. है ना? Whenever they are complete, it is known as unionized. And whenever they get split, it is ionized. Here also this one is unionized and this one is ionized. So for the drug we have two form. Unionized matlab complete. And ionized matlab it is already forming the ions. Either A positive or A negative or B positive. Got it? It is ions. It is splitted. It is forming the ions. है ना? Now please learn a rule. Body want to take the complete drug. है ना? The complete drug that is unionized is absorbed. And once the ions are formed, this or this, ions are formed, which is having some charge on that, plus or minus, it is excreted. So the ionized form is excreted. So learn this golden rule, learn this rule, all the questions will be done. Hana. Now the next question, how to acidify the urine and how to basify the urine. By our choice, I can change the pH of the urine. How? If I want to make the urine of my patient basic, because patient have taken acidic drug, I want the drug to get excreted. So I want to make the urine basic. So I will give IV directly. I will make a drip. I will not give a tablet. I will give a drip. IV infusion of sodium bicarbonate. है ना? Na2CO3. Sodium bicarbonate. If I give sodium bicarbonate, the urine automatically will become basic, alkaline. And if the patient have taken basic drug too much, the patient is in poisoning of basic drug, I want to acidify the urine so that it get excreted. है ना? So acidification के लिए again I will give IV. It's an emergency. I will give IV directly. So IV of two things. Number one, arginine hydrochloride followed by ammonium chloride. Arginine hydrochloride followed by ammonium chloride. These two things will acidify the urine. Got my point? Say yes. Now we will see many questions based on that. Listen, see your question right now. Read the question and tell me the answer. What is the best way? In a patient with arsenic poisoning? Now you must know that arsenic is an acidic drug. Nobody is going to teach you that. Arsenic is an acidic drug. You must know that. We are assuming ये तुम्हें पता है. If you don't know, please learn. Arsenic is the acidic drug. And you want to treat your patient. The patient is the case of poisoning. You do not want absorption. You want excretion. And excretion is done in opposite medium. Excretion is not done in same medium. Excretion is done in opposite medium. So it is an acidic drug. No? Arsenic is the acidic drug. So you want to make the urine basic. You want to make the urine basic or alkaline. How to make the urine basic or alkaline? By giving an IV drip of sodium bicarbonate. You got my point? Now, instead of aspirin, if I give you some basic drug here, so what is your answer in that case? If I give you name of any basic drug, your answer will change. In that case, you want to acidify the urine. So you will give the IV drug with ammonium chloride, arginine hydrochloride and ammonium. So in that case, answer will become A. I hope you are getting it. Let me show you a few more questions based on this concept. Everyone got it? Read the question. Acidic drug is ionized at. It's a tricky question. It's very easy, but it's tricky. So acidic drug is ionized at. What do you mean by ionized? I told you, unionized form is absorbed, but ionized is excreted. I told you or didn't told you? I told you, na, ionized matlab once the charges are there, plus or minus charges are there, it's ion. Body do not want charges. Body ko charges pasand hi nahi hai. Body excreted. So ionized form is excreted. So basically, I want to ask you, acidic drug is excreted in which pH? It's an indirect way of asking. Okay. So acidic drug is excreted in which pH? And for excretion, opposite pH is required. For absorption, same is required. But for excretion, opposite is required. So for acidic, the pH should be alkaline. In that way, my answer will be A. Okay. So that's why my answer is A. And if I change here the question basic drug, what is your answer? Here again, I am asking ionized. Ionized matlab excreted. Ionized ka matlab hai excreted. So basic drug is excreted in acidic pH. In that case, my answer will become B. So you get many simple questions on that. Read one more question on this concept. Which of the following is true about acidic drug? Tell me a true statement about an acidic drug. The acidic drug is best absorbed in acidic medium. Say yes or no. Or it is best absorbed in alkaline medium. Say yes or no. From these, one will be correct. It is not absorbed in acidic medium. Or it will bind to alpha-1 glycoprotein. What is the correct answer? For absorption, same medium is required. Acidic is absorbed in acidic, basic is absorbed in basic. I told you. So for acidic drug, acidic medium is required. So correct answer is A. So simple questions come. No? Last question. No, these all are your PYQs, believe me. Acetylcysteine, that is the same aspirin. This is the chemical formula of aspirin. And phenobarbital. These are absorbed from the stomach. Why? Why they are absorbed from stomach? They are not absorbed from intestine. Why? What is the reason? Why they are absorbed only from stomach and not from intestine? Why? They're not asking whether they are acidic or basic. They are giving you a hint, a clue in the question that they are absorbed from stomach. Why they are absorbed from stomach? Because they both are weak acids. They are not strong acid. They are weak acids. Okay. Acidic drugs are absorbed from acidic medium. They are not bases. Okay. They are acidic drug. But they remain ionic or anionic. They remain ionic or non-ionic. Anionic at gastric pH. At gastric pH they are absorbed. And absorption wala form kaun hai? It is the unionized form which get absorbed. So answer is A. They are non-ionic at gastric pH. Okay. So I hope you got the answer. Anyone have any confusion? Anyone have any confusion? Please write down your doubt very specifically without any hesitation. I will repeat, but you have to ask for that. If you got it, give me a thumbs up. Can we go ahead? One more question. Alkalinization of urine is done for which poisoning? The patient is having poisoning of which drug? Then you will do the alkalinization of urine. For weak acid, for weak base, for strong acid, from strong base. Please learn a rule. For strong acid or strong base, we don't do anything because they don't ionize. Strong acid and strong bases, if these are the drugs, they are pH independent. They don't depend on pH at all. They don't. They are absorbed from stomach also. They are absorbed from intestine also. And they are excreted in acidic urine. They are excreted in basic urine. They are pH independent. So don't fall in the trap. We are talking about weak acid and weak base. Whatever rules I told you, that is for weak acid and weak base. Say yes if you got it. So we are talking about urine. Urine is a medium of excretion. It is not absorption, it's excretion. So we are talking about excretion. But excretion occurs in opposite medium. So we are doing alkalinization, matlab basifying the urine. We are basifying the urine for excretion of acidic drug. So answer is A. In that way, the answer is A. If I change the question, if I do acidification of the urine is done for, my answer will be B. So we can ask many questions. Now coming on the next concept, I hope everyone got it. Okay, coming on the next concept, the third topic. Okay, we will be discussing many topics today. Okay, the next topic is the prodrug. You frequently get question on a prodrug. What is a prodrug? All of the following are prodrug except. Do you know the list of the prodrug? Today I am going to give you many mnemonics also in entire pharmacology. So nearly today I will give you 10 to 15 mnemonics. In the 3 hours that is only possible. But I will try to give you maximum content here. Okay. Now all of the following are prodrug except. First you guess what is the answer? What is the answer? The correct answer here is captopril. It's a very frequent question they ask. Let me explain. What is a prodrug? What is a prodrug? Listen. Same diagram. Listen. So I'm having some disease in my body. For example, headache, diarrhea, constipation, heart failure, or any disease for which you are a doctor. You have prescribed me a drug. That ma'am, please take this drug and you will be all right. So this is the drug I am taking via oral route, by mouth I am taking. So the drug will go inside my mouth, in my esophagus, in my stomach, in my intestine. If the drug you have given to me, if it is acidic, it will be absorbed from stomach. We have seen that. And if you have given the drug basic to me, the drug you have given is basic, it will be absorbed from intestine. Ultimately, the drug reaches in the blood. You know that, and this is absorption. Now, sometimes this drug is inactive. It is inactive. Whatever drug you have given to me, it can be acidic basic. Sometimes, I will give you the list. It is inactive. So if it go to the site of action, it will not show its action. No, it will not, because it is inactive. First, you have to make it active. So again, first the drug will go in the liver. In the liver, inactive drug get converted to active drug. And once it become active, then again it will come in the blood, and via blood it will go to its site of action and show its site of action. Show its mechanism of action in the site of action. So these drugs are known as prodrug. Prodrug are the drugs which are activated inside the body, inside the liver in the body. These are prodrugs. Most of the drugs are directly active, which you are giving the patient, they are directly active. If it is directly active, once it get absorbed, it will directly go to its site of action and show its mechanism of action. But if it is a prodrug, it cannot go to its site of action and show its mechanism of action because it is inactive. If I'm having headache, migraine, you are giving a drug, ma'am, take this tablet. I'm taking it. It is going inside, it is absorbed from stomach or intestine, whatever. It gets absorbed. It reaches in the blood. From the blood is going everywhere. The receptor of the drug is present in my brain. But drug is not unable to show its action in the brain. My headache is not treated because it is inactive. So first, via blood only, it will go in the liver. Liver will convert inactive to active and again release the active form in the blood. And via blood, again, it will come in the brain and then it shows its action. It is a prodrug. So learn the list. Learn the list of the prodrug. Okay, so let me tell you the list and let me tell you a mnemonic. Got it? Anita, you got it? I have repeated what is the prodrug. Okay, so learn the list of the prodrug. How many prodrugs are there? There's a mnemonic we are having. This is a list. This is a big list. So I'm having a mnemonic. The mnemonic is all prefer doing MD in clinical subjects. You also want to do MD in some of the clinical subjects. It's a mnemonic. So all prefer doing MD in clinical subject. So you have to learn the initials. है ना? So one or multiple drugs from one letter. है ना? I will say again. All prefer doing MD in a clinical subject. Now I will tell you the list. है ना? First learn the first letter so that you can learn the list. From A, we are having ACE inhibitors. A मतलब ACE inhibitors. What are ACE inhibitors? I will tell you today only what is ACE inhibitor. All prill, जितने भी prill वाले drug हैं, all prill are the ACE inhibitor. So all ACE inhibitors are prodrug except two prill, which are not prodrug, which are directly active. Captopril and lisinopril. Absolutely right, Kusum. Yes. So it's captopril and lisinopril. These are not prodrug. Anna, these are not prodrug, they are directly active. Otherwise, any other prill, ramipril, perindopril, there are many prill. They all are prodrugs. P stand for three things: prednisolone, proton pump inhibitor, and proguanil. Okay. D, there are two D. है ना? One D is dipivefrin and one D is levodopa D. Levodopa D. है ना? M is again three: mercaptopurin, methyl dopa, and minoxidil. So methyl dopa and levodopa, both dopas are there. Okay. C is cyclophosphamide, clopidogrel, and carbimazole. And S is sulfasalazine. Now don't try to mug it up. At least read it 2 to 3 times. My advice. Read it 2 to 3 times. It will be there in the options. Now looking at the options, you will identify. Looking at the options, you will identify. Looking at the options. Now see all the options. Now apply your mnemonic. You can see captopril is the ACE inhibitor, but it is coming in the exception. It is not a prodrug. And remaining all are prodrug. I hope you got it. Say yes. One. Okay, not more question on this concept. This is prodrug. So coming on the next topic, I guess 5th topic we are studying. We have already seen 4 topics. Okay, in this way we will cover many topics today. Give me a thumbs up. Are you ready? Can we go ahead? Okay. So coming on the next question, all the drugs are metabolized by acetylation except. So the question is based on acetylation. You will say, ma'am, the question is on metabolism of the drug. We have already seen the absorption. We have seen the pH dependency of the absorption. Now one question on metabolism. So what is the answer? Can you guess first? Then I will give you the correct answer. First you guess what is the answer. Then I will give you the correct answer. First you guess, no? Then I will tell you. So what is the correct answer? Yes, the correct answer is phenytoin. I will show you the question again. Don't worry. Let me explain. So see, again the master diagram. You are giving a drug to your patient. Your patient is having some disease. I am your patient. I am having headache. You are giving the drug to me. I'm sorry. You are giving a drug to me. So just a second. Let me open the chat. So the drug is going inside. It gets absorbed either from stomach or intestine. It reaches in the blood. From the blood, it has gone to its site of action and shows its mechanism of action. It's already done. So absorption is already done and distribution is already done. There is no problem in that. Now I want to excrete the drug. So drug is going in the kidney, but kidney is saying, no, I cannot excrete you. So the drug is asking, why kidney? Why you cannot excrete me? The kidney is saying, because you are non-polar. I excrete only polar drug. Because in the kidney, the drug will be excreted via urine. Urine is water. You know what is urine? It's water. So only polar drugs are soluble in urine and they get excreted out. Non-polar cannot excrete it. So kidney is saying, no, you are a non-polar drug. I cannot excrete you. First get converted into polar. Go to the liver. Ask the liver to convert you from non-polar to polar, then come to me. Then I will excrete you. So the drug is going to the liver and asking the liver, can you please convert me from non-polar to polar? So inside the liver, there are cells which are known as hepatocytes. So liver is saying, yes, come inside my hepatocyte. Inside my hepatocyte, there are certain enzymes. There are certain enzymes that will convert you from non-polar to polar. This is known as metabolism or biotransformation based on which our question is right now. So inside the liver, metabolism or biotransformation takes place in which a non-polar drug gets converted in polar so that it can excrete it out of the kidney. So there are 2 types of metabolism. There are 2 types of biotransformation. Both takes place in liver only. One is phase 1, one is phase 2. Phase 1 and phase 2. Listen, what is phase 1 and phase 2? Here the drug in phase 1, the drug is going in the liver. This is the hepatocyte of the liver. The drug enters inside the liver. And how does this liver convert non-polar to polar? There are 2 mechanisms. One way it can expose certain functional groups on its surface, maybe OH, maybe amino, है ना, maybe carboxy, maybe OH, COH, है ना, multiple groups. These are the functional groups. So this is phase 1. So that non-polar get converted to polar. This is a drug which is non-polar. Liver want to get converted into polar. So what does the liver will do? Liver will expose the functional groups on its surface, multiple functional groups, and because of which it convert into polar. This is known as phase 1. This is known as phase 1, in which because of the functional groups, the drug convert from non-polar to polar. Learn the basics. Okay, got it. So we are converting a non-polar drug to polar drug in phase 1 by exposing functional group. By exposing functional group. There are 5 methods by which we can do so: oxidation, reduction, hydrolysis, cyclization, decyclization. This is phase 1. Phase 1. In phase 2, again, this is liver. So drug is going in the liver. Liver, please convert me from non-polar to polar. So this drug is non-polar. This drug is non-polar. Liver want to convert it into a polar drug. What the liver will do this time? How it will get converted into polar? So liver will combine this drug with a substance. There is another substance. This is endogenous polar substance. है ना? So this is the drug which is non-polar. This is the drug which is non-polar. When it get combined with a polar endogenous substance, the conjugate which is formed, the ultimately conjugate, the couple, the conjugate is polar. The conjugate, ultimately the conjugate is polar. In this way, we are converting a non-polar drug to polar drug by combining it with someone. है ना? This is known as conjugation. There are 6 ways of conjugation depending with which we are doing the conjugation. If we are combining the drug with glucuronide, it is glucuronide conjugation. It can be glycine conjugation, glutathione conjugation, sulfate, methyl and acetyl. Currently the question is on acetylation. है ना? So it is triple G SMA. See, I'm summarizing. है ना? So I'm talking about metabolism of the drug. I'm talking about the metabolism or biotransformation of the drug. So this takes place in liver. The first thing. है ना? What do you mean by that? Liver convert a non-polar drug to polar drug. There are 2 mechanisms liver do so. Phase 1 or phase 2. है ना? In phase 1 also this is happening. In phase 2 also this is happening. So there are 2 mechanisms by which the liver convert a non-polar drug to polar drug. In phase 1, it is the functional group which get exposed and the drug get converted from non-polar to polar. In phase 2, there is conjugation of the drug with some certain substance so that the drug convert from non-polar to polar. Ultimately, drug convert from non-polar to polar. Got it? So there are 2 phases, phase 1 and phase 2. In phase 1, there are 5 methods. And in phase 2, there are 6 methods. Hana, learn the names. You get questions on the name. Which of the following is phase 1? Which of the following? So in phase 1, it's oxidation, reduction, hydrolysis, cyclization, and decyclization. Very easy to learn. Oxidation, reduction, cyclization, decyclization, and hydrolysis. Hana, in phase 2, there are 6 methods. Triple G SMA. Hana, it is glutathione, glycine, glucuronide. Okay, sulfate, methyl, acetyl. Currently the question is on acetylation. So basically you have to learn the examples of all, but maximum questions come on acetylation. So I'm teaching you the drugs which are metabolized by acetylation. So I'm having a mnemonic for you. The mnemonic is CHIPS ABC. CHIPS CHIPS ABC. So 5 plus 3 total 8 drugs are there which are which are metabolized by acetylation. That is the type of phase 2 conjugation. Say yes if you got it. So what is the full form of CHIPS ABC? C stands for clonazepam. It is a sedative. You know what is a sedative? We take the drug to sleep. Some people have sleeping problem. So we give clonazepam. The second H is hydralazine. It's an antihypertensive drug. We give in hypertensive patient. I is isoniazid. It's an anti-tuberculous drug. We give it in TB. P is procainamide. S is sulfonamide. One of the sulfonamide. It's an antibiotic. A is acebutol or amiodarone. B is benzocaine. And C is caffeine. I know learning the mnemonics is difficult. I agree. I totally agree with you that learning the mnemonics is very difficult. But my advice for you, my advice is that please combine all the mnemonics at one place. If you wish, I can provide you all the mnemonics. I can provide you a PDF. So please combine all the mnemonics at one place and stick it on your wall or read it at least in 2-3 days. Before your exam, at least if you have given 4 to 5 reads, don't try to mug up. Just read it casually read it. In the options, you will definitely recognize कि ये मेरे mnemonic में था कि नहीं था. Learn the mnemonic. Don't try to mug up the full form here. Just read it 4 to 5 times. That's it. This is the best way to learn the pharmacology. So intentionally, I have put the questions here which contains the mnemonics so that I can provide you maximum mnemonics today in today's session. Okay, so here you have to learn. So the mnemonic is CHIPS, 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 ABC. These are the 8 drugs which are metabolized by acetylation, and believe me, it's a very frequent PYQ. If you are FMG aspirant and if you have seen your PYQs in FMG, it's a very common PYQ in NEET, PG and other exams also. Okay, so let's go ahead. Okay, so read this completely. Read this mnemonic. I'm not repeating. CHIPS ABC. Okay, now read your question and tell me the answer. Who will tell the answer? Read your question. All of the following drugs are metabolized by acetylation except, they are asking except, apply the mnemonic. You know acetylation का mnemonic क्या है? CHIPS ABC. CHIPS, CHIPS ABC. Now I hope you are understanding the acetylation. It's the phase 2 metabolism. So in this mnemonic, you can see isoniazid is coming here. I for isoniazid. Okay, you can see hydrolazine is also coming here. H for hydrolazine. Now the real confusion. If you know the mnemonic and don't know the full form, you will get confused between phenytoin or procainamide. So P stands for what? P is phenytoin or procainamide? The other will be your answer. So P is procainamide. This P is procainamide, but phenytoin is not coming in this mnemonic. You can see this P is procainamide. Now P is procainamide. It is not phenytoin. So that's why my answer is phenytoin. I hope you can make it out now. So learning the mnemonic is good, but seeing the full form multiple times is important. It's better if you can understand and learn the full form. Okay. So coming on the next question. The next question is ultra important. Enzyme inhibitors and enzyme inducers. You get many questions on that. The options may be different. The question may be inhibitor or inducer. Options may be different, but frequently, more or less every year you get questions on this concept. And students have a real confusion. They don't understand the meaning. They just learn it, mug it up, and they just forget. So I will explain you the two concepts now. Enzyme inhibitor and enzyme inducer. First, give a guess. What is the correct answer here? All are enzyme inhibitors except, I'm asking which of the following is not enzyme inhibitor. Again, I will give you the 2 mnemonics now. Rather 3 mnemonics now. What is the correct answer? Is it carbamazepine, cimetidine, valproate or ketoconazole? Yes, the correct answer is carbamazepine. I will come on the question again. Don't worry. Let me explain. Listen. Now in the liver, we are again talking about the liver. Listen, start from the beginning. Last time I'm showing you this diagram. After that, we will come on systemic pharmacology. This is the general pharmacology. This is the important diagram. That's why I'm showing the same diagram again and again. Based on the same diagram, I am teaching you 10 concepts. 10 different concepts, and definitely you are going to get 1 or 2 questions based on this. Okay, anyways, come back. Listen, start from the beginning. We are taking a drug by mouth. Chalo ji, start. The drug is going inside. Okay, it's going inside. It gets absorbed from stomach or intestine, depending the drug is acidic or basic. If acidic, absorbed from stomach. If basic, absorbed from intestine. Doesn't matter. Ultimately, it reaches in the blood. Ultimately, the absorption is complete. Now, drug is going to its site of action. The site of action can be various organ depending on the disease. Okay, it will show its mechanism of action and treat the patient. The patient is treated. The patient is cured. Okay, now I want to excrete the drug. The drug is going to the kidney. Can you excrete me? Kidney is saying no. First, you get convert from non-polar to polar. You are a non-polar drug. Go to the liver. Liver will convert you from non-polar to polar. Then come back to me. Then I will excrete you. So the drug is going to the liver. Again, we have a problem here. You'll say, what's the problem? There are enzymes. The things are good if you give only one drug to your patient. But we never give one drug to our patient. We rarely give. Patient comes to me, doctor. Now, this is a liver. I have zoomed out this diagram. I'm showing you liver in a zoom version. Only liver. I'm zooming out the liver to explain you what is the problem here. You can understand the overview. Now, let me zoom the liver to show you what is the problem here. Now, there is a patient coming to my clinic. Doctor, I'm having fever also, I'm having acidity also, I'm having vomiting also, I'm having multiple problems. So definitely I will give multiple drugs now. For fever, I will give paracetamol. For vomiting, I will give something. For this, for infection, for antibiotic, I will give a cluster of drugs. It's not only patient will come with one complaint, I will give one drug. No. Even if the patient is coming with one complaint, maybe sometimes we prefer multiple drugs. So we are giving multiple drugs to a patient. Understand, this is the problem. For example, we are giving 2 drugs. If we were giving only one drug, the things were simple. This is drug A. This is drug A. For example, I am giving only A, not B. And A is a drug. This is my object drug. I will call it a substrate or object drug. So A is going inside the liver. I'm a non-polar drug. Can you convert me from non-polar to polar? Liver is saying yes. Come inside my hepatocyte. This is the hepatocyte. Can you see? And inside my hepatocyte, there is an enzyme. Cytochrome P450, the name of the enzyme. That will, you combine with that enzyme, and that enzyme will convert you from non-polar to polar. And then you can go and excrete it. So drug A was very happy. Yes. So it is coming inside. Can you see this is the enzyme? This is the enzyme present inside the hepatocyte of the liver. This is the enzyme I'm talking about. And this blue enzyme is converting the red drug. Converting the red drug from non-polar to polar. Drug is happy, get excreted happily. Everything was very good. Till we were giving one drug. But the problem is that we are giving B also. Along with A, we are giving B also. This is the problem. You will say, ma'am, what is the problem? B is an enzyme inducer. See, I have drawn plus sign here. Plus. Plus matlab enzyme inducer. B is the drug which is inducing this enzyme. Inducing matlab the enzyme will become hyperactive. Hyperactive matlab this enzyme become hyperactive. It will convert entire drug A, non-polar to polar, before it shows its action. I want the drug A to get converted from non-polar to polar, but after it has shown to its mechanism of action, then I want the conversion, then I want the excretion. But sometimes the enzyme here is hyperactive. Before the drug have not shown its mechanism of action, as soon as it enters in the blood, it gets converted from non-polar to polar and get excreted. So drug is not showing its action. The target drug is not showing its action. So here there is decreased intensity and decreased duration of action of the object drug if you are giving these two drugs together. So being a doctor, you should never give these drugs together. You should never give these drugs. One is target and one is inducer. You got my point? Here B is an inducer drug, A is object. This is a deadly combination. You got my point? Say yes if you got it. So you will say, ma'am, what is the list of that drug? Being a doctor, you should know that. This is your object drug. Never give it with these. Never give it with these, which are enzyme inducer. If you give the combination, any of these with any of these, I will tell you the mnemonic. You have to learn the mnemonic. If you give, what will happen? The object drug, mechanism of action cannot be shown. Its duration of action and intensity will be reduced. Because object drug will be excreted out of the body before it shows its action. I don't know how many of you got it, but I tried my best. Trust me. Say yes if you got it. Say yes. You got it? So it is the mechanism of action. The object drug will not show. Its duration, its intensity, everything will reduce. If you give the object drug with the inducer. So what are the object drugs? Say yes, people respond. Respond quickly. Give a gesture that you got it. So what is the list of the object drug? The object drug mnemonic is CT scan. CT scan is the mnemonic. So C for cyclosporin, T for tacrolimus, S for statins. Okay, another C is for cisapride. A is amiodarone and N is Navars. You know what Navars? The protease inhibitors and anti-HIV drugs. In the AIDS treatment. Got it? Never give any of these with the inducers. In the inducers, the mnemonic is GPRS, cell phone battery dead. GPRS, cell phone battery dead. Now learn the full form. They call full form. Rectification to hai boss. You have to learn. There is no way you have to learn. Eat almonds, eat walnut, sharpen your memory. Wake up in the morning, read the list, go ahead. Every day read the mnemonics first in the morning, the first thing you do, and then start your studies. So make a schedule. Dekho boss learn to karna padega. This is the easiest way I'm telling you. You can do it. So wherever it is conceptual, I'm giving you the concepts, but wherever there is a facts, I cannot change the facts. List to learn karni padegi, pharma hai to. ठीक है, चलो. So G stand for greasephulvin. P stand for phenytoin. You know greasephulvin is an antifungal drug. Phenytoin is an anti-epileptic drug. R for rifampicin. It's an anti-TB drug. Okay, and anti-leprosy also. S for smoking. Smoking is considered as a drug here. C for carbamazepine. Okay, again an anti-epileptic drug. P for phenobarbital. It is a sedative. B for barbiturate. Actually, barbiturate is a type of phenobarbital only. And D is DDT. It is a pesticide. So never give CT scan with GPRS cell phone battery dead. Never give CT scan. Never give CT scan with GPRS cell phone battery dead. Just suppose my patient is coming to me, doctor. I'm having some fever, some bacterial infection. So I'm giving the antibiotic, and patient is having some fungal infection also. So I'm giving greasephulvin. I'm giving this cyclosporin along with greasephulvin. No, this is a deadly combination. You shouldn't give it. If you give it, cyclosporin will not function. These drugs will not function. They will function, but these will not function. So this is the list. You must understand the list. You got it? This is inducer. Now tell me another mechanism. One more thing I want to teach you here, the inhibitor. Listen. Come here. Again, I was giving only one drug. Drug A. The things were super simple. Drug A was going inside the liver. Liver, can you convert me from non-polar to polar? Please convert me so that I can get excreted out of the body. Liver is saying, yes, of course, why not? Come inside me. Come inside my hepatocyte. There is an enzyme. You combine with that. The cytochrome P450 is the name of the enzyme. This is an enzyme. You combine with that. That enzyme will do the conversion. It's very easy. Come inside. So the drug is coming inside, binding with the enzyme. It get converted from non-polar to polar, get excreted. Drug was happy. Everything was good till now. But now we are giving another drug B. There is a problem. There is a problem in B. This time B is inhibiting this enzyme. It is not inducing. It is inhibitor. It is an enzyme inhibitor. Okay. It is an enzyme inhibitor. Okay. It is inhibiting. So this is making this enzyme non-functional. What do you mean by non-functional? This enzyme is totally non-functional. Now this time if A is asking liver, can you convert me from non-polar to polar? Liver is saying no, my enzyme is dead, I cannot convert you, go back. So this drug cannot be excreted. The drug A cannot be excreted from the body. It will remain in the body only. It will cause toxicity. After showing its mechanism of action, the drug A has already shown its mechanism of action. Now drug A want to get excreted, but it cannot be excreted. It will remain in the blood only and it will show toxicity. So here the drug A will show, the object drug will show toxicity. So again, the substrate drugs are same. The list of the substrate is same, that is CT scan only. So never give CT scan with the inhibitors also. If you are giving the CT scan with the inhibitors, so there will be toxicity. There will be toxicity of the object drug. The object drug will have its toxicity. Got it? If you are giving the object drug with the inducer, the object drug will not show its mechanism of action. The mechanism of action will be less. The intensity will be less. The duration of action will be less. But if you are giving the object drug with the inhibitor, there will be toxicity. I hope you are getting it. I don't learn these concepts. I understand these. You got my point? So inhibitor का list है. Vitamin K cannot cause enzyme inhibition. This is a mnemonic. V stand for valproate. K stand for ketoconazole. C stand for cimetidine. One more C stand for ciprofloxacin. E stand for erythromycin. You know erythromycin is an antibiotic. And I is isoniazid. That is anti-tubercular drug. My summary. If you got it, it's good. If you have missed anywhere, see the summary. Come back. Everyone come back and see the summary if you have missed anywhere. Don't worry. This is an object drug. Don't give them with these. Don't give them with these. Don't give them. Don't give object with the inhibitors. Don't give the object with the inducers. Don't give. Don't give the object drug with any of these. You have to learn the combination. These drugs, whenever you are prescribing, someone was asking how to avoid alternate account. You are asking how to avoid it. Learn it. No, learn it. Beta, learn it. Being a doctor, you should know the list. If you are a doctor, you are giving any of these drugs to your patient, you should be aware. No, I'm giving some substrate drug. And what combinations I'm giving? I should not give any of these. I should not give any of these. What happen if you give? What happen? What will happen? If you give the substrate drug with any of the inhibitor, the substrate drug will have toxicity. This combination, if you give, the substrate drug ka toxicity milega. Toxicity. And if you give this combination, if you give the substrate drug along with the inducer, the substrate drug will have reduced intensity and reduced duration of action. That is, the mechanism of action will be less. Here mechanism of action is more, here it is less. I hope you are getting it. Say yes if you got it. Everyone. Any confusion? So never give CT scan with GPRS cell phone battery dead, and never give CT scan with vitamin K cannot cause enzyme inhibition. Never give CT scan with this also. So whenever you give CT scan to your patient, learn the full form of CT scan. These are dangerous drugs. Whenever you are prescribing CT scan to your patient, any of these, beware. Don't use these. Don't use these along with that. Otherwise, either the object drug will not function or it will do toxicity. Anything can happen. Avoid these combinations. Say yes, everyone. Got it? So we will see the question. Now, apart from these two, there is a third mechanism, which is known as Hoffman's elimination. Listen. Here, you are taking a drug. You are giving a drug to your patient. The drug is going inside, getting absorbed, either from stomach or intestine, reaching the blood. Now, drug is not going in the liver. No, it is not going in the liver because usko pata hai liver mein bahut jhol jhapata hai na? It's not going in the liver. This time what the drug is doing? But this is a non-polar drug. You will say, ma'am, it's a non-polar drug. Still it is not going to liver. Why it is not going to liver? If it is non-polar, how it will get excreted from the kidney if it is a non-polar drug? It should go to the liver, but it is not going to the liver. In the blood itself, it get converted from non-polar to polar. You will say, ma'am, how it get converted? The drug will do certain rearrangement inside its molecule in the blood itself. Molecular rearrangement. Without the use of enzyme. It is not using cytochrome P450, which is present over here. Without enzyme, the drug get metabolized. Only one drug do so. It's a very important question. What is that? The name of the drug? That drug. Atracurium. Only one example. You have to learn. It's a very important PYQ. So this is known as Hoffman's elimination. Hoffman's elimination takes place in the blood itself. The drug is not at all going in the liver. एक ही drug है वो जो करती है, only one drug does so. The name of that drug is atracurium. Atracurium convert non-polar to polar in the blood itself by doing molecular rearrangement, है ना, without the agency of enzyme. It don't use cytochrome P450. It don't use cytochrome P450. The name of that drug is atracurium. It shows Hoffman's elimination. Okay, got it. Say yes. Now have a look on the question. What was our question? Have a look and you tell me the answer now. You tell me the answer. See the question and tell me the answer. Who will tell me the answer? All of the following are enzyme inhibitors except. First tell me the mnemonic of enzyme inhibitor. What is the mnemonic of enzyme inhibitor? Huh? What is the mnemonic? Vitamin K cannot cause enzyme inhibition. This is the mnemonic. Apply the mnemonic. Vitamin K cannot cause enzyme inhibition. Okay. So see, valproate is coming here. है ना? Ketoconazole is also coming here. है ना? C for cimetidine is also coming here. One more C is there. It is not carbamazepine. No. It is ciproflox. So carbamazepine is the answer because carbamazepine is the inducer. It is coming in the list of the inducer. That's why my answer is there. So if you know the mnemonics, things are super simple. Okay. Few more questions based on that and we will move on the next topic quickly. Read the question and tell me the answer. Read the question and tell me the answer. Can you read the question and tell me the answer? Please. Which of the following drug is an enzyme inducer? What is the mnemonic of the inducer? Huh? GPRS, cell phone battery dead. So in this mnemonic, what is coming? What is coming? I guess rifampicin is coming. R for rifampicin. Huh? R for rifampicin is the answer. It is coming in this mnemonic. If you know the mnemonic, things are very simple. So R for rifampicin. The other three options, that is isoniazid, ketoconazole and erythromycin, they are coming in inhibitors. You can see. Hana? You can see isoniazid is coming, ketoconazole is coming and erythromycin. The other three options are the inhibitors. Only this one, that is rifampicin, is coming here. R for rifampicin. It is coming in the inducer. So you have to learn both the list. You get many confusing questions over here. The next question, which of the following is the inhibitor? What is the mnemonic? Pehle mnemonic batao, boss. What is the mnemonic? For the inhibitor, what is the mnemonic? Vitamin K cannot cause enzyme inhibition. So what is coming here? I guess two are options. Ketoconazole and isoniazid both are coming. Ketoconazole and isoniazid both are coming. So by mistake, I have marked one. Answer should be both. So you can see ketoconazole is also coming here and isoniazid is also coming here. So you get many questions on that. One more last question. Repeatedly asked question. Okay. Repeatedly asked question. Okay. So Hoffman elimination is. What is Hoffman elimination? Read the options. I told you what is. Only one drug shows Hoffman elimination, atracurium. Ye bhi PYQ hai. It's a very important PYQ, atracurium. But what is Hoffman's elimination? How you will define it? Huh? It is inactivation of the drug by metabolizing enzyme. It is using of the enzyme. Or it is unexchanged excretion by the kidney. It is non-polar only, it is going in the kidney. Or it is excreted in the feces. Or it is inactivation by molecular rearrangement. What do you say? Huh? Say yes. Yes, the correct answer is D. It is without the agency of the enzyme. Without the agency of the enzyme, this happens. So correct answer is D. Okay, so coming on the next concept, Hana, one of the important concept of the excretion, then the general pharma will be over. And after that, we will be moving on the systemic pharma. One by one, we will take the systems and we will see few questions on the systems. Hana? So we will try to cover maximum. I guess you are learning it. Hana? Say yes. Everyone enjoying. So here I am teaching you only 40-50 questions in the 3 hours. I will cover maybe 40, maybe 50 questions. Actually, it's not 40-50 questions I will cover. I am covering 40-50 topics. And from these 40-50 topics, I am covering 500 questions. So consider that. In each topic, many questions are there. I'm giving you one question. But based on that, many other questions you can create. Now, one topic. So we are covering many questions in the 3 hours. The maximum I can give you. That is the maximum yield. The next question is based on order of kinetics. Zero order or first order, you frequently get confusing questions on that. So what is true about the zero order? And if I change the question, what is true about the first order? There are two orders. You will say, ma'am, what do you mean by order? I guess 90% of the students who are attending my lecture right now, they don't know what is the order of the kinetics. Hana, they don't know. Don't worry, I will explain. Okay, listen. So I will show you the question again. Hana, don't answer right now. I will show it again. Let me explain what is order of kinetics. Currently, I am interested in excretion of the drug. Come directly to the kidney. Hannah, you have taken a drug by mouth. It is already going inside. It is already absorbed. And absorption is done. There is no problem in that. We have seen pH dependency. The mechanism of action is also done. है ना? And in the liver, the non-polar get converted to polar also. Here also we have seen everything, the inducers, the inhibitors, the Hoffman conversion, we have seen everything. Now it's time to excrete the drug. The drug is already polar and it is coming in the kidney. Can you please excrete me? Kidney saying, yes, why not? You are a polar drug, come inside me, I will excrete you in the urine. So let's talk about excretion. Let's talk about excretion. How much drug will be excreted in the urine per minute? What is the rate of excretion? Every minute, how much is coming in the GFR? GFR is glomerular filtration rate. You know, inside the kidney, we have nephrons. One kidney, human have a pair of kidney. We all have two kidney. One kidney contain 1 million nephron. So humans have approximately 2 million nephron. In the nephron, you know, I guess you know the structure of the nephron. There is glomerulus, PCT, loop of Henle, DCT and collecting tubule. So this is the afferent arteriole coming here. And this is the efferent arteriole going back. Hai So inside which the drug is present. Here is the drug. The drug is coming here. So drug want to get excreted. Hai So drug will get filtered over here. Hai and the remaining drug will go. So every time the blood is coming, the drug is getting filtered. It is known as glomerular filtration rate. And here it will go, it will excrete it in urine. So per minute, what is the glomerular filtration rate? That is known as rate of excretion. That is known as rate of excretion. So kidney is definitely excreting the drug. There is no doubt in that. But what is the rate of excretion? How much milligram or gram of drug excreted per minute? 1 minute में कितना जा रहा है from the blood? Just suppose in the blood 10 milligram is there. Out of 10 milligram in 1 minute, how much is excreted in the urine? What is the rate of excretion? So there is a formula. है ना? Now we will read a little bit about the chemistry. है ना? A little bit about the chemistry. Okay. What is the rate of excretion or elimination? The rate of excretion or elimination is directly proportional to plasma concentration of the drug to the power of the order. This is a formula. Now let me ask you a question. Listen. Let's take a simple example. है ना? Basics से समझेंगे. We don't know anything about it. We will start from the basic. Just suppose the plasma concentration. You can see this is the kidney. है ना? The drug is coming in the kidney. Some amount of it will be get excreted and the remaining will go again. And next time the remaining will be excreted. The next time it will be in multiple time. It is not the one time drug is coming and all of a sudden it is excreted in urine. The plasma is cleared. No. Every minute the blood is coming in the plasma. A little bit is excreted in the urine. And the remaining is coming. The next time, the remaining is coming. It's a cycle. Hai na? One time will come when 100% drug is excreted out of the blood in the urine. So just suppose the plasma concentration is 10 milligram. For example, 10 milligram per ml. This is the plasma concentration of drug in my blood. And I want to excrete it in my urine. So every minute, 1 milligram is excreted. Every minute. For example, it's just a numbers. It's example. Hai na? So if 10 milligram is in the blood, 1 milligram, 1 minute is excreted. It is the rate of elimination. It is excreted via urine, for example. So instead of 10, if I do it 100 here, so what is the rate of excretion? If the plasma concentration is 10, the rate of excretion is 1. If the plasma concentration is 100, what is the rate of excretion? What if the plasma concentration is 1000? What is the rate of excretion? I'm asking you a question. Can you answer it? Can you answer it? Say yes, say something. Huh? Can you say? So if the plasma concentration, and this is rate of elimination. I'm saying if the plasma concentration is 10, it is eliminated at 1 milligram per minute. Now what if it is 100? What will happen here? What if it is 1000, 10,000? What will happen here? So I'm increasing the plasma concentration. I'm giving 1 tablet to the patient, the concentration is this. I'm giving 10 tablets to the patient. The patient have tried to do the suicide. Patient has taken 100 tablets. The concentration is this. So what is the rate of excretion? No, you cannot answer it. You cannot say anything. No, you should say, ma'am, it depends. Correct answer is, ma'am, it depends on the order of kinetics the drug is following. There are 2 types of drugs. You should ask me, ma'am, drug is following 0 order or first order. There are 2 orders. So first put here 0 and then put here 1 by 1. The order is in the power. In the power put 0 or in the power put 1. 1 by 1 we will see. Drug follows 2 order. Some drugs follow 0 order. Some drugs follow first order. I will give you the list in the end. Which follows 0, which follow first. First understand the meaning. Bhai, meaning to samjho. Matlab kya hai 0 order? You say, ma'am, being a doctor, is it necessary for me to understand? Yes, it's very necessary for you to understand. I will explain you why. Listen. Now, if the plasma concentration is 10, the rate of excretion is 1. I said if the plasma concentration is 100 or 1000 or 10,000, if the drug is following 0 order, now rate of elimination is directly proportional to plasma concentration to the power 0. Anything to the power 0 is 1. I mean rate plasma concentration to the power 0 is 1. I mean rate of elimination is constant. Rate of elimination doesn't depend on plasma concentration. Bhai, plasma concentration 10 hai, 100 hai, 1000 hai, 10,000 hai. Kidney is ideal. I use the word ideal. It will excrete 1. Whatever. If you do 1 lakh also, plasma concentration, kidney will excrete 1 minute. Kidney say, no, I will excrete only 1 milligram in 1 minute. whatever is the plasma concentration. These are ideal drugs, है ना? Zero order kinetics, I call them ideal, है ना? They are very ideal. What do you mean by ideal? They are stuck. That kidney is stuck. Kidney will excrete only fixed rate. So here a fixed amount of drug is excreted every time, a fixed amount, है ना? It is 1 milligram only per minute. It is just an example, है ना? It doesn't depend on plasma concentration. You are increasing the plasma concentration or reducing the plasma concentration. Instead of 10, if it is 1 also, still it is 1. So you are increasing or reducing, doesn't matter. Kidney will excrete fixed amount of drug. Got my point? So these are very dangerous drugs. You are asking the patient to take 10 milligram, for example. है ना? Patient is not feeling well. So without asking you, sometimes Indian patients especially do that. Without asking the doctor, without consulting the doctor, they double the tablet. ठीक है, एक से फर्क नहीं पड़ रहा, दो ले लेते हैं. They take it very casual. Ideally, they should consult doctor. Shall I double the dose? Shall I increase the dose? I'm not feeling well still with one dose. है ना? So they are increasing the dose. Instead of 10, it is 100. But kidney is still excreting 1. So there will be toxicity. They can have toxicity. These are very dangerous drugs. The zero order. The zero order. So here rate of elimination is constant. Here a constant amount of drug is excreted every time. Say yes. On the contrary, there is another type of drug which is first order, which is following the first order. Got my point? Okay. So here the rate of elimination is directly proportional to plasma concentration to the power 1. So it is directly proportional. If you increase the plasma concentration, rate of elimination will increase. If you reduce the plasma concentration, the rate of elimination will reduce. I mean, if the plasma concentration is 10, the rate of elimination is 1. If you do it 100 here, instead of 10, it's 100, means 10 time rise. Here also, instead of 1, it will be 10. 10 time rise. Here, instead of 10, if it is 1000, here also, instead of 1, it will be 100. So, I mean, the 1/10 of the drug is excreted every time. Here also, it's 1/10. Here also 1/10, here also 1/10. So here I will say a fixed fraction of drug. वहाँ पे fixed amount था, यहाँ पे fixed fraction है. Fixed amount is not there. So these are not dangerous drugs. If you are increasing the concentration of the plasma, it is excreting more. If you are reducing the concentration, it is excreting less. So the rate of excretion depends on the plasma concentration. That is first order. How many of you got it? These are not dangerous drug. These are not dangerous drug. Okay. Okay. What you are asking, Samir? Kindly को zero फर्क पड़ रहा है. Yes. Kidney को zero. हाँ. Yes, absolutely right, Samir. I think you are asking something. Yes, absolutely right. So we are having two type of drugs. What are the two type of drugs? So being a doctor, you should know which are zero and which are first. Maximum drugs are first order. 99% drugs following first order, and they are not dangerous. By mistake, if patient instead of 1 tablet, patient is taking 2 or 3 tablets, it's okay. Patient will not have toxicity. If the patient will take more drug, the absorption will be more, the plasma concentration will be more, the excretion will be more. So drug will not accumulate in the blood if it is the first order. But if the patient is taking a zero order, and patient is taking more dose, so absorption is more, plasma concentration is more. But here kidney is ideal, so kidney is still excreting 1. Patient is having 10, 100, 1000. Kidney is excreting 1. So there is accumulation of drug in the plasma, and it will cause toxicity. So here these are dangerous drugs. These are dangerous drugs. You should know. These are only 1-2% of the drug. You should know their names. You should know. So whenever you prescribe any of the zero order drug to your patient, you should ask the patient, never alter the dose. If you want to alter the dose, consult me first. Otherwise, these are dangerous drugs. मन से dose नहीं ऊपर नीचे करना है. ऊपर नीचे करोगे तो पछताओगे. You can have toxicity, you can die. Then I'm not responsible. You should warn the patient at least. Got my point? These are dangerous drugs. Got my point? So here, rate of elimination is constant. Here, rate of elimination is directly proportional to plasma concentration. Here, rate of elimination is constant. It doesn't depend on plasma concentration. Plasma concentration 1, 10, 100, 1000. Kidney is ideal. Here, rate of elimination is directly proportional to plasma concentration. If it is more, rate of elimination is more. If it is less, rate of elimination is less. Here, a constant amount of drug is excreted by the kidney. Always 1. Remember the example? Here, a constant fraction is excreted. Always 1/10. So here, constant amount, here, constant fraction. I'm trying hard to explain you. I hope you got it. So what are the drugs which follow zero order? Zero order. What are the drugs? So I will give you a mnemonic again here. So the mnemonic is zero. Zero se yaad aayega zero. Zero order. 0 watt. You know, WATT. Watt is the power. A unit of power, है ना? Watt power, 0 watt power bulb. You can learn a mnemonic, है ना? W stand for warfarin. It's the anticoagulant. So never dare to alter the dose of anticoagulant. So whenever you are prescribing any anticoagulant to your patient in case of DVT or thrombosis, if you are giving any anticoagulant like warfarin, ask the patient, stick on the dose. Whatever I have prescribed, please stick on the dose. है ना? Don't alter it by your choice. You can have toxicity. Okay. A stand for alcohol. It's a cushion, and aspirin. Alcohol and aspirin. If you have seen, someone is drinking the alcohol 1 pack. the person is in control. But even on 2 or 3 packs, sudden the critical line is crossed, and patient can have certain the various CNS effects because it is toxic. है ना? Initially it was excreting in the urine, but now it is accumulating in the blood because it is addial. है ना? So if the alcohol concentration is less or more, kidney will excrete the same. Got my point? There are 2T, 2A and 2T. 2A is alcohol and aspirin, and 2T is theophylline and tolbutamide. And power, P stand for phenytoin. Hana, you have to learn the mnemonics. I'm sorry, but you have to learn. So the zero order kinetics is followed by W, double A, double T power. Hana, this is the mnemonic. Watt power. So warfarin, alcohol, aspirin, Hana, P is phenytoin. What are the 2T? What are the 2T? Tolbutamide and theophylline. So please learn it by heart. These are dangerous drugs. है ना? For passing exams, ठीक है, you have to learn it. है ना? But being a doctor, you should know that. है ना? One day you will prescribe drugs to your patient if you are taking medicine, especially if you are doing MD in medicine. You are going to prescribe all these drugs to your patients. है ना? So you should be aware that it is a dangerous drug. So don't forget to warn your patient. Warn the patient that don't alter the dose. These are dangerous. Otherwise, Indian patients especially, they think doctor to ऐसे ही है. Doctor have taken one, asked me to take one tablet, I will take two, I will take three. It's okay. What will happen? Nothing will happen. They can die. They can have toxicity if the drugs are these. So warn the patient. So being a doctor, you should know their names. This is zero order. Okay, so we are done with this concept. Coming on the next concept. One more concept. Okay, ji. Okay. So let's come on the next concept. Okay. Patients are first enrolled in which phase of clinical trial? You know what is a clinical trial? Now, suppose you are a scientist and you have discovered a new drug for any disease, for malaria, for HIV, for some cancer. You have discovered a new drug and you are claiming my drug, which I have discovered right now, it's better than the old drugs available in the market. And or else you have discovered a new vaccine for any disease, any treatment or any disease vaccine you have discovered. So will you get the license to launch it directly in the market? No. You have to do the experiments. You have to do the trials first. First, you will do it on animals. Then you will take the permission. Then you will do it on humans. And there are 4 trials. Phase 1, phase 2, phase 3, and finally phase 4. In phase 4, it is launched in the market. So you will not get the permission or license to launch any of the new drug or new vaccine directly in the market. It cannot be used in the patient. Before that, there will be trials. So how many trials are there? There are basically 4 phases. So phase 1, phase 2, phase 3, and phase 4. Okay, so please understand the meaning. Phase 1 is done on healthy volunteers. It is done on healthy volunteers. You will do the informed consent that it is a new drug and we are testing it. We do not know whether it is having good effects, bad effects, and you will test it on healthy people. You will not test it on patients. You will not test it on patients. It is just to see the safety and tolerability. And it is a volunteer. You will inform the person. It is not a patient. You will inform the healthy person that we are doing a trial. It is for the benefit of the community. It is for benefit of the country or for the, for the benefit of humanity. So you are doing, maybe you will die. We don't know. And you will take the signature that if anything happened, we are not responsible. Got it? So it is the voluntary volunteers. We will do it on healthy people, not on patients. Phase 1 is done on healthy people. And we check safety and tolerability of the drug here. It is done for 2 years. And success rate is 50%. And we do it on 100 participants, maximum 100. And if we get a success over here, the government, the ethics committee will give you the permission to do the second one. The ethics committee will give you the permission to do it on the second phase 2 trial. Phase 2 is done on the patients. Phase 2, 3, and 4 are done on the patient. That is our question right now. Phase 1 is done on healthy persons. 2, 3, 4 is done on the diseased person. So first time patient pe trial phase 2 mein hota hai. Phase 1 is not patient. Phase 1 is healthy. That is our question right now. Phase 1 is done on healthy volunteer. Phase 2 onwards, 2, 3, 4 is done on the patients. Here the number is 500. Here maybe up to 1000. And here many thousands. Got it? Here we are testing the efficacy and dose ranging. Here we are testing the efficacy and dose ranging. Here we were testing safety. पहले safe है कि नहीं वो देखना है. Tolerability कितना tolerable है. उसके बाद efficacy है कि नहीं and dosing. Here also efficacy and dosing. And finally here we will see the adverse effects. Finally here we will see so each phase have its own relevance. Here it is done for 2 to 3 years. This is for 3 to 5 years. And here it is post marketing. Once phase 1 is done, phase 2 is done, phase 3 is done, you will get the permission to launch it in the market. So in the market, it will be available on the medical stores and all hospitals. The patients will use it. The doctors will prescribe it. And post-marketing, we will see the adverse effects. For years, there is no fixed duration. There is no fixed duration. So these are the 4 phases. You may have seen maybe in COVID vaccine, we have done the exception. COVID vaccine is, it is created just in 10 to 11 months. It is maximum in 1 year. Ideally, it takes, if you add all of them, phase 1, 2, 3, it will be 10 years. It will be 10 to 11 years. So instead of 10 to 11 years, it is created in just 1 year, because it was an emergency situation, and there was a regulation passed on that. Otherwise, this is the, generally this is the thing which is done. So there are 4 phases. Now read your question. What I'm asking, patients are first enrolled in this phase of clinical trial. First time patients are enrolled in phase 2. In phase 2, है ना? And instead of patient, if I ask healthy volunteer, what is your answer? In that case, answer is 1. And sometimes they can ask you the safety is tested in which phase. So answer is phase 1. Efficacy is tested in which phase? Answer is 2 and 3. And adverse effects are tested in which phase? Answer is 4. So you get many important questions, है ना? Here from the 4 clinical trials. Can I go on the next question? Can I go on the next question? Okay, there are many rules, Sasika. They can demand for money. So it all depends which drug we are testing. And there are many regulations. Don't go in the detail. Just learn the 4 phases and go ahead. Maybe sometime if some life-threatening side effect or maybe death is happening, so the government will do the compensation to the family. Maybe sometime it happens, but not always. Depends from condition to condition. Okay, so chalo, we will go on the next question without wasting our time here. Okay. So let's go on the next question. The site of action of furosemide. Now we will solve some questions based on the systemic pharmacology. We have seen many important topics of general. I know I have not covered 100% general because I am allotted only 3 hours today. Hana, 5:30 to 8:30. 8:30 I have to end the session because from 9 onwards you are having some other session, I guess. Hana. I guess I'm having 3 hours. So I have divided nearly 1 hour for the general and 2 hours for the systemic. Howsoever I can cover maximum, I'm trying to do so. So from general, I have taken nearly 15, 20 topics, maybe 15 topics I have taken. Now let's start the system. Let's start. So first we will see the renal system. From the renal system, we will see few questions. Okay, read the question and tell me the answer. Okay, read the question. Okay. So read the question. Okay, we will try to take another sessions also. Let's see if the team allows and if everything goes smooth, we can plan more sessions. Let's see, but we will try to cover maximum in this session first. Okay, what is the site of action of furosemide? Hana? So first understand the question. Hana, no, the first thing, before starting systemic pharmacology, let me tell you something. Okay, let me give you an advice. Now, in the systemic pharmacology, you are having 10 to 12 systems, है ना? CVS है, CNS है, renal system है, ANS है, PNS है. You are having 10 to 12 systems, है ना? Blood है, GIT है. You are having various systems. I will not be able to cover all the systems here, but important which are frequently asked in competitive exam, we will take that. My first advice, learn the classification. Learn the classification of all the drugs. All the important drugs at least. If you can't learn all the classification, there are nearly total 50 classifications which are important. I advise you to read it at least one. So if I tell you the name of a drug, you can identify, ma'am, this drug is a diuretic. It belongs to kidney. It is a diuretic. Then only you can answer. अब तुम्हें पता ही नहीं है कि furosemide क्या होता है. It is a drug used in CVS, CNS, kidney. So how you can answer? You cannot answer. So first thing is to learn the classification. Do you have classification? All classifications together at one place. If you don't have, I will share with you. Hai? So learn the important 40, 50 classifications. Important classification. Don't learn it even. Just have a look, read it 2 to 3 times. So that if any drug they ask you, hai, you should be able to identify that this drug belongs to which category. If you don't understand your question, how you can answer it? Got my point? Hai? So first thing, learn the classification. That is the advice. Okay, to follow or not, it's your choice. Okay. So come on the furosemide. You can identify that furosemide is a diuretic they are asking. Okay, what is a diuretic? Diuretic is a drug which is given in edema. Edema of any cause. Hai na? It's edema. Edema means swelling. If the patient is coming to you with a swelling anywhere in the body, here, complete body, anywhere, internal swelling, external swelling, any type of edema. So you give diuretic. Diuretic is not curative, but it is a symptomatic. What does the diuretic will do? So extra water present in the form of the swelling that will be excreted in urine. So basically, diuretics are the drugs that will increase the excretion of sodium and water in urine. They will increase the excretion of sodium and water in the urine. These are the drugs known as diuretics. Okay. Now I will come on the question again. Before that, let me show you the classification. Now this type of classification, you have to learn all the classifications here. If you don't have, ask me. I will share you all 50 classification in this way. You have to read it. So this is a classification of the diuretics. There are three type of diuretics: highly effective, high ceiling, moderately effective, and weak. Highly effective, if you give one tablet, patient will have liters of urine. All the extra. This is given in emergency. Patient have pulmonary edema. Patient can't breathe. The lungs are swelled. Come on. Give a single shot, injection or tablet of any of the furosemide, torsemide, bumetanide. All the extra water will be excreted in the urine. There will be liters of urine and all the swelling will be subsided. It is given in emergencies, number one. Emergencies also, and non-emergencies sometimes you can give. The moderately effective are the thiazides. Here the high efficacy are known as loop diuretics. These are loop diuretics. Here there are three drugs. Furosemide is the main drug here. Bumetanide and torsemide is also there. Here we are medium efficacy, we have thiazides. Read the name. How many thiazides we have? Chlorothiazide, metazolone, zipamide, indapamide, clopamide, and hydrochlorothiazide, hydrofumethazide, benzthiazide. So thiazide. So these are the thiazides we have. Moderate may we have thiazides, and weak may we have three classes. Okay, carbonic anhydrase inhibitors we are having. We have only one drug here, acetazolamide. Osmotic diuretics are the sugars. We have mannitol here, and potassium sparing diuretics. The main drug here is spironolactone. It's not written here. You can write down spironolactone and amiodarone. So these are the main drugs here. Okay, now listen. You have to learn the classification. In the pharma, you have much learning portion. Ratification hai, but learn the classification. Classification is the thing you have to learn. Okay. Now let me give you one letter here to explain you everything about the diuretic. Maximum question of the diuretic you will be covered if you learn one mnemonic here. Listen. Loop diuretic, say L. L for loop. These are the loop. Thiazide, say T for them. These all are T. T for thiazide. And the weak one, carbonic anhydrase, I will call them C. C for carbonic anhydrase, O for osmotic, and P for potassium sparing. So I'm having 5 classes. Listen, I'm writing. Listen. Diuretic. You got it? What is a diuretic? Diuretics. There are 3 type of diuretics: high, moderate, and weak. High efficacy, moderate efficacy, and weak efficacy. Weak efficacy are of 3 types. High may loop, L for loop. Moderate may thiazide, T for thiazide. And weak may there are 3 classes. Carbonic anhydrase inhibitor C, osmotic diuretic, and potassium sparing, COP, COOP you can learn. So please learn LTCOP. I want you to learn one letter. L for loop, T for thiazide. This is carbonic anhydrase inhibitor, osmotic, and potassium sparing. Please learn it. Now they all act on the nephron. Where is the nephron? This is a nephron. How many portions the nephron have? Nephron have 5 portions. I guess everyone knows this is glomerulus. This is glomerulus. This is PCT. This is loop of Henle, the descending limb of loop of Henle, the ascending limb of loop of Henle. The loop of Henle have 2 limbs. You can see. This is DCT, distal convoluted tubule, and this is collecting duct. Now you are having 5 portions and you are having 5 categories of the drug. Now each category act one place. You have to learn a mnemonic. Dekho. Understand. Dekho. The mnemonic is COLTP. COLTP. And you know the sequence in the nephron. Nephron में सबसे पहले क्या आता है? Glomerulus. None of them act on the glomerulus. उसके बाद PCT, then descending limb of loop of Henle, then ascending limb of loop of Henle, then DCT, then collecting duct. I guess everyone knows this sequence. Write down COLTP. COLTP. I mean to say, carbonic anhydrase inhibitors acts on PCT. Osmotic diuretics acts on descending limb of loop of Henle. Loop diuretics acts on ascending limb of loop of Henle. Thiazides act on DCT. And potassium sparing, all the potassium sparing, they act on collecting duct. No need to learn. You got the sides of all 5 together with one mnemonic. The mnemonic is COLTP. COLTP. So here it is PCT. सबसे पहले क्या आता है? PCT, then descending limb of loop of Henle, then ascending limb of loop of Henle, then DCT, then collecting duct. If you don't want to learn the nephron, you can learn like this. Say yes, people respond. So you get many questions on the site of action. So all carbonic anhydrase inhibitors act here, all osmotic act here, all the loop diuretic, that is furosemide, that is our question right now, act here. All the thiazides act here and all the potassium sparing act here. So what is the mnemonic? Say again. The mnemonic is COLTP. COLTP. This is carbonic anhydrase inhibitor. This is osmotic, loop diuretic, thiazides and potassium sparing. And you know the sequence in a nephron. Close your eyes and say the nephron. Nephron mein kya parts hain? Say in a sequence. Don't include glomerulus. After glomerulus, we have PCT. Then we have descending limb of loop of Henle. Then we have ascending limb of loop of Henle. Then we have DCT. And then we have collecting duct. So you got the site of action of all 5. And I am assuming that you know the classification. You know the name of the drugs in each category. I am assuming that. If you don't know, please learn that. Hannah, got it? Now read your question. You get many questions on that. They are asking for furosemide. What is furosemide, by the way? What is furosemide? It's a loop diuretic. So instead of furosemide, learn the word L. L kahan act karta hai? Where does the L act? So the mnemonic is COLTP. They are asking where does the L act? Where does the L act? Huh? What is the answer? So here you say, how do you say? Say this one is PCT, this one is descending limb of loop of Henle, this one is ascending. So my answer is ascending limb of loop of Henle. This one is DCT and this one is collecting duct. So ascending limb of loop of Henle is my answer. Hannah? Now if I change the question here, instead of furosemide, if I give you mannitol, what is mannitol? You should know the classification. देखो बॉस क्लासिफिकेशन नहीं पता तो कुछ नहीं हो सकता फार्मा में. सीधी सी बात है ना, सटीक सी बात. तुमको ABCD नहीं पता, तुम चले हो CAT कैट DAT रैट रटने में तो कुछ नहीं होगा. फर्स्ट लर्न द अल्फाबेट्स, है ना. फर्स्ट लर्न द नंबर्स 1 2 3 4, देन लर्न द एडिशन, सब्ट्रैक्शन, मल्टीप्लिकेशन. यू कैन नॉट डायरेक्टली जंप. I mean, there are steps, है ना. Learn the classification. The पहली चीज तुम्हें नहीं आता तो learn it. Still you have time. If you can't learn, at least read it. At least read it. Believe me, if you read it now, in the options, you will identify. है ना, you will identify. Okay, chalo. Yeah, mannitol is an osmotic diuretic. In that case, answer will be B, descending limb of loop of Henle. Got it? Now, if I change the question to acetazolamide, what is your answer now? What is acetazolamide? It's a carbonic anhydrase inhibitor. In that case, my answer will be PCT. Got it? And if I do any of the thiazide, benzthiazide, chlorothiazide, clopamide, zipamide, indipamide, इनमें से कुछ भी दे दूं, any of the thiazide, so my answer will be DCT because they all act on DCT. So you think one question, I have covered many questions. It is not this every time they will ask furosemide. No, they are not crazy people. They will not ask the same question every time, but the topic will remain same. So the site of action is ultra important in diuretics. Please learn the mnemonic COLTP. COLTP. So write down like this. C, that is PCT. O, descending limb of loop of Henle. L, ascending limb of loop of Henle. T is thiazide. And P, that is potassium sparing diuretics on the collecting duct. And you know the classification, it's very easy. It's very easy, है ना? Okay. I'm having a question for you. Listen the 5 questions first. है ना? It is a fast. Have you ever seen KBC? Huh? कौन बनेगा करोड़पति? So in KBC, to come on the hot seat, the candidates have to arrange, है ना, in a particular sequence. They have to do arrangement in a particular sequence. So we are playing KBC. I want to see who is the fastest finger first. है ना? So I want the first person to answer it correctly. I will show you the options. Before that, understand the question. है ना? I will give you 4 drugs now. All of them will be diuretics. I will show you 4 options ABCD. है ना? You have to tell me they all will act, of course, on the nephron. From the proximal portion of the nephron to distal portion of the nephron, you have to arrange them in a sequence. So which of them act on PCT, then descending limb, then ascending limb, then DCT, then collecting tubule. You have to arrange them in a sequence of the nephron. You know the parts of a nephron. So arrange them in a sequence from proximal to distal. The 4 drugs will be in front of you. So your options will be ABCD, CDBA, DBAC, CDAB. Like that, you have to do the arrangement. I want to see first person. I want to see the first person who is correct. So your options are in front of you and your time starts now. Okay. See. So can you arrange and tell me what is the correct answer? Among these, what is the correct answer? ABCD में से क्या answer सही है? Can you do the arrangement? Huh? Okay. Let me give you a clue. Okay. So who is the first to answer? Let me see. Then I will explain you. None till now. Oh my God. Huh? Yes, apply cold P. Abdul, apply that and tell me the answer. Don't tell me the mnemonic. So anyone? Yes. So many students are saying B and Umang Gupta is the first one to tell the answer. So yes, congratulations Umang, you are first. And many students are correct after that. Okay, chalo. So triamtarin is a potassium sparing diuretic. So I will say P. है ना? Hydrochlorothiazide is a thiazide. So I will say T. है ना? Acetazolamide is a carbonic anhydrase inhibitor. I will call it C. And bumetanide is a loop diuretic. The brother of the furosemide. Furosemide का बड़े भैया हैं ये bumetanide. So I will call it as L. है ना? Loop diuretic. Now you know the mnemonic called P. So CO is not given. COL LTP. So CDBA. CDBA. Answer is correct. B is correct. I hope you got it. Now you can guess which level question you can get. It's a very difficult level question. It's a question of INCT. It's a question. But anytime you can get any question in your exam. It is not the same question you will receive. But based on that, you can get any of the questions. So correct answer is this one. And many of you are correct. I guess all of you are correct. Very correct. So coming on the next question. Okay, so this was a concept in the diuretics. Now I'm not teaching you the uses and side effect of all 5 diuretics. Normally when I teach the complete pharma in detail. So I take all, loop diuretics. The first I take loop. Then I take thiazide, the moderate wala. High efficacy, moderate. Then weak mein I take 3. Carbonic anhydrase inhibitor, osmotic and potassium sparing. I make a comparative table between all 5. Usually when I teach in detail. So first I teach the site of action of all of them, which I've already taught you. Maximum questions are on site of action. Site of action, which I've already told you, it's cold P. So I've told you. Then the mechanism of action I tell you in detail. Then the uses of each of them and adverse effect of each of them. You'll say, ma'am, use the same, they all are given in edema. Osmotic are not given in edema. They are given in other uses. Or yahan pe bhi kaun sa edema? This one is given in pulmonary edema. This one is given in cardiac edema. This one is given in hepatic edema. Likewise, I tell in detail, but there is no time. And for adverse effect, I tell the mnemonics. I tell the mnemonics here, the 5 mnemonics, the 5 adverse effect. In this way, all the questions get covered, but there is no time. I cannot teach you the complete pharmacology in 2 hours. No, it's impossible beyond human limits. So site of action pe maximum PYQs hain. So I have covered this. I'm moving to the next system. Okay, chalo. The next question is on antibiotics. Okay, G. Chalo. So if the time allows, I will take many sessions. I will take multiple sessions. I'm trying to get you maximum in this session. Chalo. The next question is on tetracycline. Tetracycline is the antibiotic. So we will take few questions on the antibiotic quickly now. Okay. Okay. So the question is in front of you. Tetracycline inhibit protein synthesis by. The tetracycline inhibit protein synthesis by. The question is in front of you. What is the options? Can you see the options and tell me the answer? Okay. We will see the question again in the end. Let me explain you. Okay. So listen. There is a patient in my clinic. See, I'm telling you a story. There is a patient in my clinic. The patient is having certain infection caused by a microorganism. The patient is having an infection caused by a microorganism. Say, ma'am, who is a microorganism? There are 4 types of microorganism. It can be a bacteria, it can be a virus, it can be a fungus, it can be a parasite. They all cause infections in human. And my patient is having infection by one of them. So my patient is sick. My patient is ill, having the infection. And I am a doctor. Being a doctor, I want to treat my patient. What should I do? Say, ma'am, if it is a bacteria, give antibacterial. If it is a virus, give antiviral, give antifungal, give antiparasitic drug. So that particular drug will kill the microorganism. So these are known as antimicrobial drugs. Antimicrobials are the drug that kill the microorganism. They can be antibacterial, antiviral, antifungal, and antiprotozoal. Antiparasitic, I mean. So am I a murderer? I'm murdering the bacteria which is present in my patient's body. I'm murdering the virus, fungus and parasite which is present in my patient's body. I am a doctor. I want to save my patient. To save my patient, I have to kill the microorganism present in his or her body. So I am a basically murderer. Basically all doctors are murderer of the microorganism, not of the patient, of course. So we want to save the humanity. Okay, so that is the meaning of the doctor. So we are killing the microorganism. Okay, but nobody wants to get killed. These organisms also don't want to get murdered. If you murder me, I will do the defense. In the same way, if you do the murder, I mean kill any of the microorganism, they will show the defense. Defense is the resistance. Resistance is they will resist killing. So they will develop various mechanisms inside them by which they can show the resistance. And I will tell you the mechanisms of the resistance also. Now, listen. This is the bacteria. For example, this is the cell. This is not human cell. This is a bacterial cell. This is the nucleus of the bacteria. This is the DNA inside the bacteria. This is a cell membrane and this is a cell wall. This is a cell wall. And here I am drawing a ribosome. This is the ribosome on which protein synthesis takes place. Now I want to kill this bacteria. This is the bacteria and I want to kill it with a drug. There are 4 mechanisms I can kill that. The first drugs, there are certain drugs which inhibit cell wall. There are certain drugs which inhibit cell wall synthesis. If the cell wall is not there, the cell will, the bacteria will swell and burst and the bacteria will die. So there are certain drugs. I will give you the list. There are many questions based on this classification. First mechanism, there are certain drugs which inhibit cell wall synthesis and by this mechanism, they kill the bacteria. So I will give you the list. You have to learn that list. Say yes. Got it? The second mechanism, there are certain drugs which cause pores in the cell membrane, not cell wall. They cause pores in the cell membrane. pores in the cell membrane so that the cytoplasm will leak out and the bacteria will die. So I will give you the list of the drugs which act on the cell membrane. There are certain drugs which act on cell wall. They inhibit cell wall synthesis. There are certain drugs which act on cell membrane. They cause the holes or poles in the cell membrane so that cytoplasm leaks out and the bacteria will die. The third drugs, there are certain drugs which act on the nucleus. They inhibit nucleic acid synthesis, maybe DNA synthesis inhibitors and RNA synthesis inhibitors. I will tell you these drugs also. I will tell you these drugs also. So the third mechanism. And the fourth and the last mechanism, there are certain drugs which act on ribosome and they inhibit protein synthesis in the bacteria. They will inhibit the protein synthesis in the bacteria. Say yes if you got it. Got it? Okay. So yes. So there are certain drugs which act on the ribosome and they inhibit protein. So there are 4 ways to kill this bacteria. Tell me the 4 ways. Now first learn the name of the drugs in each category. So currently in this session, I wish if I could have time, I can show you all 4 categories. I will give you the name of the drugs in all 4 categories. So maximum questions will be on this only. The mechanism of action. What is the mechanism of action of penicillin? What is the mechanism of action of sulfonamide? What is the mechanism of action of tetracycline? Currently, our question is based on mechanism of action. So there are only 4 mechanism of action. There are only 4 mechanism of action. I will give you the list of the drugs. You have to learn that. Now, details I will give you of these one and these one. These two I will give you much detail. That is uses, adverse effect, anything. And these 2 category I'm not covering right now because it is a rapid revision. Okay, now listen. So these are the 4 kind of drugs you have seen. So Amit, you can search by default on the YouTube. You will get many sessions and you will get, okay, you will get some or other, not complete, but some information you will get it. Anyways, coming on the mechanism of action. In the mechanism of action, I told you there are 4 categories. There are certain drugs which inhibit cell wall synthesis. There are certain drugs which cause holes in the cell membrane. There are certain drugs which inhibit protein synthesis, and there are certain drugs which inhibit nucleic acid. So first I will give you details of this, then I will give you details of this. First see the list of all. Okay, now let's start. List I forgot to put. I will share later on. So come on protein synthesis inhibitors. So here are 4 drugs I am going to teach you in detail. Tetracycline. Right now I will teach you. Tetracycline, chloramphenicol, aminoglycoside, and erythromycin. Macrolide or erythromycin. You can learn TACE or TCA, whatever you learn a mnemonic. These are 4 protein synthesis inhibitors. They all act on ribosome. The thing is that they all act on ribosome. They all act on ribosome. They inhibit protein synthesis, but different step of ribosome. So you have to understand. So these are the 4 ribosomes. These are the 4 drugs I have shown you. One of them is tetracycline. This is aminoglycoside. This one is tetracycline. This is chloramphenicol. And this is erythromycin. You are getting my point? Yes or no? So the step is different. If you want to understand the mechanism, first you have to understand normal protein synthesis in a bacteria. How does bacteria synthesize protein? If you don't understand that there are 4 steps, then I will tell you the which step is inhibited by which antimicrobial. First understand the normal 4 steps. By hoti kya hai 4 steps? Then I will tell you which step is inhibited by which of them. Got my point? So see, this is the bacteria. This is not human. See how does bacteria synthesize protein? Everyone on the screen. Everyone on the screen. This is a bacteria. Give me a thumbs up on every slide. You got my point? This is a bacteria. This is the nucleus inside the bacteria. This is a double-stranded DNA inside the bacteria. So bacteria is there. Nucleus of the bacteria, double-stranded DNA inside the bacteria. Now this bacteria want to synthesize protein. How does it do so? The 2 strands of the DNA separate from each other. You know, one is leading, one is lagging. I guess everyone knows. One is leading, one is lagging. On the leading strand, suppose this is leading and one is lagging. On the leading strand, this is leading. mRNA synthesis takes place. And this is known as transcription. This step is known as transcription. Transcription is conversion of DNA. You know, the DNA is forming a complementary mRNA. So DNA to mRNA is transcription. Now this mRNA will leave the nucleus and come in the cytoplasm. This mRNA, you can see DNA get converted into mRNA. The leading strand of DNA get converted to mRNA. This takes place in the nucleus of the bacteria. The leading strand of the DNA converting into mRNA. This is transcription. Now this mRNA will leave the nucleus and come in the cytoplasm, in the ribosome. So see, this has left the nucleus, already left the nucleus, and it has come in the cytoplasm of the ribosome. Now let me zoom the ribosome to show you the 4 steps. Now on the ribosome, you see this is the ribosome. Now on the ribosome, what will happen? This mRNA convert into protein, and this is known as translation. There are 4 steps in translation. I will teach you in detail. You got my point? You got my point? Now this is a ribosome. See everyone? See? So yes, first DNA get converted to mRNA, and then mRNA get converted into protein. Protein is the chain of amino acid. So this step takes place in the nucleus and this step takes place in the cytoplasm. This one is known as transcription, and this one is known as translation. Translation. This is how protein synthesis takes place. Translation have 4 steps that I will tell you in detail. My point is that I'm going to teach you 4 drugs now. They all 4, tetracycline, aminoglycoside, chloramphenicol, and erythromycin, they all inhibit translation. None of them inhibit transcription. It's a very important PYQ. Okay, they all inhibit translation. You got it? So let me tell you the 4 steps of the translation. Understand this ribosome. Now you can see this is ribosome. You can see this is P window, this is A window. On a ribosome, there are always 2 windows. One is P window, one is A window. And there are 2 segments in the ribosome, 30S and 50S. Some of them act on 30S, some of them act on 50S, some of them act on both. So, इस पे भी बहुत questions आते हैं. Listen, now this mRNA is going and binding here. On the mRNA, there are codon. Codon is a triplet. So C1 is the first codon. This is second. So first codon always go on the P window. Second codon always go on the A window. Hai? Now each codon stands for 1 amino acid. You know there are 20 amino acids and there are 64 codons. You may have read this in biochemistry. So I'm not interested in the codon and the amino acid. Hai? But you may be knowing that 1 codon stands for 1 amino acid. There are 20 amino acids. You see. This is a cell of bacteria. The cytoplasm contains the 20 amino acid. Hai? Now whatever is the first codon, hai? वो आवाज लगाएगा. C1. Just suppose C1 is AUG. AUG होता है यूजुअली AUG है ना. सो वेयर एवर इज मिथियोनिन वो आ जाएगा है ना. यहाँ से आवाज लगाएंगे कि वेयर इज AUG. AUG के लिए कौन है? हु इज स्टैंडिंग फॉर AUG? सो A1 विल कम हियर. द A1 जहाँ पे भी मिथियोनिन है दैट विल कम एंड बाइंड हियर है ना. हु इज स्टैंडिंग फॉर दिस विल कम. हु इज स्टैंडिंग फॉर दिस विल कम. इन दिस पे अमीनो एसिड विल कम एंड बाइंड हियर. से यस. Got my point? Say yes if you got it. So in this way, one by one, the amino acid will come and they will bind on the ribosome. So first we will talk about the first step. Now there are 4 steps. Please understand the 4th step in detail. See. First, C1 will call for the first amino acid. Whatever is the C1, for example, it's AUG, GUG, AUC, जो भी है. So whatever amino acid standing for that will come from the cytoplasm and bind here. So this is P window. The first step takes place on P window. It is known as initiation. This is known as initiation. Initiation takes place on P window. Learn it. The second amino acid will come on the A window. This is previous amino acid. This is new amino acid. The new always come on the A window. So second step comes, the new amino acid comes on the A window. This is second step. So step 1 is initiation. That takes place on P window. Step 2 is coming of new amino acid tRNA. That is coming on A window. That is coming on A window. That is step 2. Now step 3, they will form bond with each other. Peptide bond. And the previous will shift on the new. Hana, see, first they will form, this is previous, this is new. They will form a bond between them. And the previous will go on the new. Hana, you can see, this is previous going on the new. It is known as P2A shift. P2A shift. Hana, the previous is going on the new. This is known as P2A shift. So third step is P2A. P2A. So first step, I'm revising. The first step is taking place on P. The second step is taking place on A. And the third step is P2A. The P2A. Hana, so P, A, P2A. It's very easy to understand. So third step is P2A. The amino acid is shifting from P to A. The third step. And finally, the fourth is difficult. Fourth is difficult. Listen. Can you see the ribosome? This complete ribosome is jumping by 1 codon, moving ahead by 1 codon. It will move ahead by 1 codon. 1 codon. So the C1 will be freed now. The C1 will be free. The P window will come on C2 and A window will come on C3. You are getting my point. The complete ribosome is moving by 1. But amino acid will remain here only. See मेरी बात को समझो जरा. Amino acid यहीं के यहीं रहेंगे. It is static. The ribosome, the red ribosome is moving, but the yellow amino acid chain is there only. So currently the amino acid chain is on A window. But अब A की जगह पे P आ गया ना. The P window is coming here. So it is A to P shift. The amino acid are shifted from A to P. You can see the C1 is freed. है ना? The P window is coming on C2 and A window is coming on C3. So amino acids are shifting from A to P. So last step is A to P. So what are the 4 steps, people? What are the 4 steps? Say, ma'am, first is initiation, that is P window. Then the new amino acid on A window. Then P to A shift and then A to P shift. A to P shift. A to P shift, that is jumping of the ribosome. It is known as translocation. Translocation. These are the 4 steps. How many of you got it? Let me ask vice versa. How many of you didn't got it? How many of you didn't got it? समझ में आई क्या बात? So 4 antibiotics, they inhibit one step. So initiation is inhibited by aminoglycosides. Aminoglycosides inhibit P window. They inhibit step number 1. This is first step. This is second. This is third. This is fourth. Aminoglycosides inhibit initiation. That is step 1. Tetracycline inhibit A window. That's why they inhibit the new amino acid coming there. That is, they inhibit the A window. They inhibit second step. The third is chloramphenicol. Chloramphenicol inhibit P to A. That is peptide bond formation and shifting of the previous to the new. Let me elaborate this step. And the last one, erythromycin. Erythromycin inhibit A to P, that is jumping of the ribosome, that is translocation. How many of you got it? Say yes. Hana, everyone. Does anyone have any confusion? So these are the 4 mechanism of action, the antibiotics, the 4 mechanisms. You want me to tell everything about them? So this is the aminoglycoside inhibiting the first step. Okay, this is the tetracycline inhibiting the second step. This is chloramphenicol inhibiting the third step, that is P2A. And this is the last one, erythromycin inhibiting A to P. So you got it? Say yes. So your current question is based on this. You can make out the 4 ribosomes. Okay, Hana, you want me to tell the adverse effect and uses also, the 4 mnemonics here, the 4 mnemonics here. Total 8 mnemonics are there. So we will see it very quickly. Okay, we will see it very quickly. Okay, ji, Hana. So let's start with tetracycline. Mechanism of action you already know, all 4. I have told you the mechanism of action. Let's start with tetracycline. I will be fast, Hana, because I want to teach you the adverse effect and uses. You get many questions on adverse effect and uses also, Hana. So I will quickly tell you the mnemonics and go ahead. So let's start with the tetracycline. Hana, tetracycline is known as tetracycline because it is having four benzene ring. Hana, that's why it is known as tetracycline. Hana, classification, there are 7 type of tetracycline. You should know their names. Group 1, group 2, group 3. In the group 1, there are 3 tetracycline. One is tetracycline itself. Tetracycline में tetracycline है. One is chlorotetracycline, one is oxytetracycline. है ना? Group 2 में demaclocycline and lamicycline. And group 3 में doxycycline and minocycline. Say yes if you got it. है ना? So there are total 7. Group 1, 2, 3. Group 1 में tetra, chlorotetra, oxytetra. है ना? Group 2 में demaclo और group 3 में doxy. डेमेक्लो एंड डॉक्सी. यहाँ पे डेमेक्लो के साथ लेमेसाइक्लिन और यहाँ पे मीनोसाइक्लिन. यू हैव टू लर्न, है ना? यू हैव टू लर्न. क्लासिफिकेशन तो लर्न करने पड़ेंगे. देखो कोई चारा नहीं है तो करना ही है तो हंसते हंसते कर लो. ठीक है? सो दैट इज द क्लासिफिकेशन. व्हाट डू मीन बाय स्पेक्ट्रम? है ना? वन बाय वन वी विल फिनिश दिस. आई विल गिव 3 minutes. है ना? मैक्सिमम 15 minutes में वी विल फिनिश इट. ठीक है? चलो क्विक. सो spectrum, है ना? There are 4 types of bacteria. You may be knowing gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. So tetracycline is active against all gram positive and gram negative cocci, all gram positive and gram negative bacilli. So all 4 categories it is active. Gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. It's a broad spectrum. Not only this, it is active for Rickettsia, Mycoplasma and Protozoa also. Rickettsia, spirochetes, Mycoplasma, Protozoa. So it is a broad spectrum. Mechanism of action, it inhibits step number 2. It act on the A window and it block the A window. You know, it block the A window, it inhibits step number 2. And it binds on the 30S of the ribosome. And it inhibit the A window so that the new amino acid cannot come. You know that. So it act on the 30S. And it is inhibiting step number 2. Please learn that. Coming on the adverse effects. I'm having a mnemonic for the adverse effect. The mnemonic for the adverse effect is L.K. Advani is PT teacher. L stand for liver damage. K stand for kidney damage. Liver damage, they cause jaundice. Kidney damage, they cause nephritis. Nephritis. A, they causes anti-anabolic effects. ठीक है? D, they cause diabetes insipidus, not mellitus. Diabetes insipidus, patient have frequent urination. V, they cause vestibular toxicity. You know, inside the ear we have 3 semicircular canals which cause the balancing. So that is known as vestibule. If vestibule get damaged, the patient have vertigo. चक्कर आएंगे, है ना? Vertigo. So vestibular toxicity. ठीक है? I stands for intracranial pressure rest. है ना? P stand for phototoxicity. If the patient go in the sunlight, there will be rashes on the skin. If the patient have taken any of the tetracycline, है ना? Phototoxicity. T for teeth and bones. It accumulate in the teeth and the bone. It damage the teeth and the bone, है ना? Because it chelates with the calcium. Calcium 2 ही जगह है हमारी बॉडी में, है ना? Calcium is present in the bone and the teeth. So tetracycline form a chelate with the calcium. So it bind with the teeth. The teeth will get yellow, mottled, and bone पे भी वो deposit होगा. And one more T is teratogenic. Never give tetracycline to any pregnant lady. It is teratogenic. Say L K Advi. Advani को अडवी बोलो. अडवी. P T teacher. Say the full form. Say. एक बार फिर से. L K Advi. P T teacher. चलो. Say liver damage, kidney damage, anti-anabolic effect, diabetes insipidus, vestibular toxicity, है ना? Increase intracranial pressure, phototoxicity, teeth and bone, and teratogenic. So just learn the list. This is adverse effect. Coming on the uses. The uses of the tetracycline. The mnemonic is vacuum the bedroom. Tetracycline is first choice of drug in vacuum the bedroom. V stand for Vibrio, A for acne, C for chlamydia, U and M, ureoplasma, mycoplasma, bhai. ठीक है? T is tularemia, bad room, Borrelia and Rickettsia. Say yes. Borrelia and rickettsia. So vacuum. Vacuum mein only one C is there. It's not double C. Vacuum the bad room. Say the full form. Say the full form. Huh? Say again. Vacuum. VACUM. The bad room. Say the full form. Vibrio, acne, chlamydia, ureoplasma, mycoplasma, bhai, है ना? Tularemia, Borrelia, rickettsia. Tetracycline is first choice. You get many questions out of that. है ना? Many mnemonics are there. You have to learn. So LK Advi is a PT teacher and vacuum the bedroom. So read it. We are done with tetracycline. Any question you are ready to solve. In the same way, there is an advice: complete pharma in tabulated manner. If you complete the entire pharma, you will compact the 300 pages of pharma book into 20 pages of the tables. I'm having only 20 pages. Entire pharma only 20 pages. Hana, like this. Hana, one chapter in one page. Hana, in one page, I compare multiple drugs. All diuretics, one page. All protein synthesis inhibitors, one page. All beta-lactam, one page. All CVS drug, heart failure drugs, one page. All anti-hypertensive drug, one page. In which you will get mnemonics, maximum mnemonics in the adverse effects and uses. Mechanism of action samajhna padega. How many of you got it? So this is a way to read, to study, to learn pharma. It is a unique way. Try it out. Compact entire pharma in just 20 pages. I guess everyone can revise 20 pages before going to your exam. So whenever is your exam, 2-3 days before, just revise these 20 pages. It hardly take 2 to 3 hours. In 2 to 3 or 4 hours maximum, you can revise entire pharmacology. That's a challenge. That's a challenge. I wish if I could have the time and I can teach you the 20 pages. But it takes time to teach. बोलने के लिए 20 pages हैं. But one page will require to teach at least 30 minutes. You know, it takes time to explain you once. But once you understood, revising is very fast. Hana? Coming on the next drug, chloramphenicol. Can I come on the chloramphenicol? The second drug. Chloramphenicol have a nitrobenzene. Here 4 rings, here nitrobenzene. You can skip also. Hana? Classification is not there. It's only one drug, chloramphenicol. Here we are having 7. Here we have only one drug. Okay, spectrum is same. Here also all 4. Here also all 4. The both cocci, the both bacilli. Gram positive also, gram negative also. Mechanism of action, this was inhibiting second step. This was inhibiting third step. This was inhibiting A window. This is inhibiting P2A shift. P2A shift. You know, peptide bond formation and shifting. So you know it is inhibiting peptide bond formation and P2A shift. So it is inhibiting the third step, but it bind on 50S of the ribosome. Tetracycline was binding here on the 30S of the ribosome. Chloramphenicol bind here on the 50S. So you have to learn in a chart. Ultimately chart learn kar lo. I call them master chart. I'm having 20 master charts. Hana, please learn. So here it acts on 30S, it acts on 50S. Please learn. It inhibit the second step, it inhibit the third step. This inhibit A window, this inhibit P2A shift. That is peptide bond. This is also bacteriostatic, this is also bacteriostatic. Hana? So coming on the adverse effect and uses the 2 mnemonics. Adverse effect and mnemonic hai big super hypersensitivity. Hana? Chloramphenicol. B stand for bone marrow suppression. You know bone marrow ke andar, in the bone marrow, we have hematopoietic stem cell. Okay, this hematopoietic stem cell form RBC, WBC platelet. Chloramphenicol inhibit this cell, kill this cell. So no RBC, no WBC, no platelet. Patient have pancytopenia. So it's a very severe side effect. That's why chloramphenicol is banned nowadays. Say yes. Say yes. Okay. I is irritative effects. If you take it by mouth, patient have vomiting. And if you give the injection, patient have pain. So wherever you are giving, there is an irritation of that side. I is irritation. Okay. G is gray baby. It's a very important PYQ. Gray baby syndrome is caused by, answer is chloramphenicol. Never forget. Answer is chloramphenicol. Super is super infection because it is reducing the WBC also. And hypersensitivity, yani allergy. Allergy is a side effect of all antibiotics. Users, although it's banned, so it is not first choice. It is never first choice. You can give it in these indication. If the first choice is not working, then give chloramphenicol. Otherwise, never give chloramphenicol to the patient because of bone marrow toxicity. It's a fatal side effect. So that's why it's highly restricted use. The mnemonic is Bayer TB. B for bacterial meningitis. Bacterial meningitis. One more B is there. है ना? Brucella. है ना? A is anaerobic infection. R is rickettsia. E is eye and ear infection. T is typhoid. है ना? So C, big super hypersensitivity and Bayer TB. यहाँ पे था LK Advani, PT teacher and vacuum bedroom 2. Now learning it is difficult, but looking at the option, you can easily identify. You can gray baby, there is no confusion. Teeth and bone toxicity, there is no confusion. Liver damage, kidney damage, there is no confusion. You can easily make it out. Please believe me. Coming on the third one, aminoglycoside. है ना? Aminoglycoside. They have amino and sugars, aminoglycoside. Classification. है ना? Classification. They are of 2 types, systemic and topical. है ना? Total 10 are there. 8 systemic and 2 topical. है ना? Aminoglycosides are not given oral. Tablet आती नहीं है. Aminoglycosides are not oral. They are either injectable. Injectable is parenteral, है ना? They are systemic, or they are ointments in the form of the drops and ointments, that is topical. In the form of the drops and ointments, they are never given oral. So 8 of them are systemic, they are injections. These 8 are injections, and 2 of them are ointments. You have to learn their names. I'm not reading. The mnemonics are given to you, okay? But you have to learn the names, okay? Chalo. Coming on the spectrum, है ना? This was broad spectrum. This was broad spectrum, acting on all four. This is narrow spectrum, only on one. Gram-negative bacilli. Only on gram-negative bacilli. None of the cocci. Neither gram-positive cocci, nor gram-negative cocci, not even on gram-positive bacilli. I said only gram-negative bacilli, and that too aerobic gram-negative bacilli. Very narrow range. So you have to learn. It's a very important question. So please learn the spectrum. Now compare the spectrum of all three. What is the mechanism of action? It is acting the first step. Hana, it is inhibiting the first step. The first thing, it acts on both the 30s and 50s. See, this was acting on 30s, this was acting on 50s, this is acting on 30s, 50s, and the junction also. It's a very important PYQ. This one was inhibiting the second step, this was inhibiting the third step, this is inhibiting the first step, initiation. A for initiation. A is the first letter in alphabet, na? A, B, C, D. So it inhibits the first step. Learn like that. Initiation. It inhibits the P window. It inhibits the P window. Hana, that is the mechanism of action. The adverse effect is on HT. O double N on HT. O for autotoxicity, the patient becomes deaf. Hana, deaf, number 1. And it's irreversible. Autotoxicity is irreversible. Once the patient is deaf, you stop the drug, even the patient cannot hear again. Patient will kill you. Hana, it's a very dangerous drug. So give it in the doses, recommended doses. N is nephrotoxicity. The kidney is damaged, but it's reversible. If you stop the drug, it will reverse. The N is neuromuscular, it's also reversible. Neuromuscular blockage. H is hypersensitivity. T is teratogenic. Like tetracycline, never give it in pregnancy. So on HT. Hana, on HT is the side effect. Uses, there is no mnemonic for that. Unfortunately, it is given for gram-negative bacteria. Gram-negative bacilli. You know all the gram-negative bacilli we will give it. So main use. And it is given in TB also. Hana, we give streptomycin in the TB also. Say yes if you got it. Huh? So that is the thing. Coming on the last one, erythromycin. Hana, last one is erythromycin. It is one of the macrolide, erythromycin. Hana, classification. These all are macrolides. Hana, there are 5 macrolides. The mnemonic is race T. Hana, R is roxithromycin. A is azithromycin. C is clarithromycin. E is erythromycin. The main is erythromycin, or you can learn all. And T, race T, not T. I'm sorry, race S. Race S is there. Hana, race S. Yeah, races. S is paramycin. So races. The 5 are there. You can learn races. R-A-C-E-S, races. Hana, spectrum. Dekho. Everyone on the screen. This was acting for all 4. This was also acting for all 4. This was acting only for gram-negative bacilli, hai na? So बाकी तीनों को बुरा लग गया. The other 3 were feeling bad. Why we are not included? So the other 3 are included here. See. Now see the spectrum of all 4. See the spectrum. Here all 4 are there. Here all 4 are there. Here only gram-negative bacilli. Here all except gram-negative bacilli. That is gram-positive cocci, gram-negative cocci, and gram-positive bacilli. Say yes if you got it. This is the easiest version I can tell you. Hana, mechanism of action, it is inhibiting the last step, the 4th step. And it acts on 50S only. Hana, 50S only, inhibiting the translocation, the last step. Hana, adverse effect, the mnemonic is macro, M-A-C-R-O. M is motilin receptor agonist. In the intestine, there are receptors, motilin receptor. It stimulates that and they cause the parasclerosis, they cause the diarrhea. Number 1. Number 2, A for allergy. C for cholestasis, that is jaundice. And RO is reversible autotoxicity. Autotoxicity wahan bhi tha in streptomycin, in aminoglycoside, but that was irreversible. Here it's reversible. And uses is CLAW, C-L-A-W. C is chancroid, cornybacterium and campylobacter. L is Legionella, A is atypical pneumonia, and W is whooping cough. So this is the easiest way I can summarize a chapter in just 15 minutes. And I have covered one chapter, the 4 drugs, in just 15-20 minutes. This is the easiest way. Hana, kyunki time nahi hai, this is the easiest way. So I wish you have learned the full form of these mnemonics. I wish you have learned the mechanism of action for these. Especially question come on 30S, 50S, both and 50S. Is pe question aata hai. Please, Hana, and you have learned the spectrum. You have learned the spectrum. Okay, so I want you. Everyone give me a thumbs up. Everyone. So we are done with this chapter. Can we go ahead? I'm skipping the questions. Can you read? 1, 2 we will do, and I'm coming on the next chapter. Quickly. Read the question and tell me the answer. I want to cover 3-4 more chapters in the next 1 hour. We are having 1 more hour. So I want to cover more chapters. Okay, read the question. Which of the following is a side effect of streptomycin? What is streptomycin? The first thing, streptomycin. Identify. Kahan aata hai? Streptomycin is an aminoglycoside. It's an aminoglycoside, है ना? So aminoglycoside के side effect क्या थे? What were the side effect? हाँ? What were the side effect of aminoglycoside? I told you. What was the mnemonic? The mnemonic I told you, aminoglycoside is on HT, है ना? So it is ototoxicity, nephrotoxicity, neuromuscular blockage, hypersensitivity, and teratogenic. Now have a look on the option. Huh? So yes, ototoxicity is coming, but phototoxicity and hepatotoxicity is not there. So correct answer is C. So you get very simple question. Currently our question is this one. है ना? ये question मैंने दिया था. Tetracycline का what is the mechanism of action? Huh? So yes, the answer is it is binding with 30S and inhibit the second step. Second step is binding of new amino acyl tRNA on the A window. So this is the correct answer. है ना? If I change the question from tetracycline to chloramphenicol, it will be the C. Answer will be C. It will inhibit the step number 3, peptide bond formation. If I change the question to aminoglycoside, any of the aminoglycoside, it will inhibit the initiation. A for first step. And if I change the question to erythromycin, azithromycin, roxithromycin, any of the macrolide, answer will be D. That is inhibiting the last step. I hope you are getting it. Huh? I hope you are getting it. Okay. Yes, definitely I will share the PDF. Definitely every time I do so. This time also I will share this PDF. Don't worry. Okay. I will share the PDF whichever I am teaching you right now. Okay. The complete PDF I will show you. There are many extra things also in this PDF. The mnemonics are there and multiple things which I will not teach you, but in the end it is given. So you can go through that after the session. Okay. Can we go ahead? Huh? Can we go ahead? So this is the thing. So in this one question, the 4 questions are hidden. So I request you to learn the classification and understand the concepts. Okay. Tetracycline act on 30S की 50S की both की 60S. 60S तो होता ही नहीं है. There is no 60S. Useless option. Useless option. Now tetracycline. I told you 4 drugs. Tetracycline, chloramphenicol, aminoglycoside and erythromycin or macrolides. Don't change the sequence. If you don't change the sequence, you are in safe zone. So this one is 30S, this is 50S, this one is both, and this one is also 50. Now they are asking for tetracycline. No, I will go with 30. Hana, if they ask for aminoglycoside, my answer is both. But if they ask for chloramphenicol or erythromycin, my answer will be 50. So frequently you get these questions. Gray baby syndrome, repeated ask question, answer is chloramphenicol. Big hyper super ka G hai ye. You know the mnemonic. If you know the mnemonics, things are very easy. I'm skipping these questions. Hana? Now coming on the next chapter. Read the question and tell me the answer. Is it a good way to learn pharmacology? You like the way? The simplest way? Huh? So read the question. Which of the following is a side effect of sulfonamide? The next antibiotic we are taking. Which of the following is a side effect of sulfonamide? What is the sulfonamide? Can you guess the answer? What is the correct answer here? Is it constipation, joint pain, crystalluria or hyperkalemia? So first you must understand, ma'am, sulfonamide hota kya hai? What is sulfonamide? Huh? So I will come on the question in the end. The correct answer is crystalluria. We will see. Okay. I told you there are 4 ways to kill a bacteria. Oh, I told you, na, the 4 ways. So this is the bacteria. This is the cell membrane. This is the cell wall of the bacteria. Okay, this is the nucleus having the double-stranded DNA. And this is the ribosome. I want to kill the bacteria. There are 4 ways. The first way, there are certain drugs which inhibit cell wall synthesis. I'm not teaching you that. The second, drugs which causes pores in the cell membrane. I'm not teaching you that also, which cause holes or poles. The third, I already taught you the drugs which inhibit the protein synthesis. There are 4 drugs I taught you here. Here I taught you the 4 drugs. We are already done. You know everything about them. Now the fourth and the last mechanism I'm teaching you in detail. There are certain drugs which inhibit nucleic acid synthesis. Sulfonamide is one of them. So there are certain drugs which inhibit nucleic acid synthesis. So I want to inhibit the nucleic acid of the bacteria so that bacteria get killed. Now your nucleic acid is of 2 types. Are you inhibiting DNA or are you inhibiting RNA? DNA or RNA. Listen. So both of them inhibitors are there. Listen. So whatever nucleic acid you want to inhibit, there are 2 types of drugs. Nucleic acid inhibitors. There are 2 types of drugs. Direct inhibitor and indirect inhibitor. What are direct inhibitor and what are indirect inhibitor? In the direct inhibitor, there are 2 drugs, sulfonamide and trimethoprim. I will explain you both right now. And in the indirect inhibitor, there is quinolones. Fluoroquinolones, I will explain you that also right now. So 5 minutes. In the next 15-20 minutes, we are going to cover these 3 drugs. Okay. Now, what do you mean by direct and indirect? Let me explain you by direct or indirect hota kya hai. Listen. I'm sorry, मैंने उल्टा लिखा. The sulfonamide and trimethoprim were indirect one, and the quinolones were the direct inhibitors. So this is the DNA of the bacteria. Okay. I want to inhibit the DNA. So there are certain drugs which do not inhibit DNA. Actually, for the synthesis of DNA, folic acid is required. Without folic acid, DNA cannot be synthesized. with folic acid only DNA is synthesized, है ना? So for the synthesis of DNA, folic acid is required. So there are certain drugs which inhibit actually folic acid synthesis. These are indirect inhibitors. Indirect. They inhibit folic acid. No folic acid means no DNA. So actually they are inhibiting DNA, but not directly. Indirectly they are inhibiting DNA synthesis. So indirect inhibitors are sulfonamide and trimethoprim, which is our question right now. Sulfonamide and trimethoprim. And the direct inhibitors, mequinolones will come. The direct inhibitor directly inhibit the DNA. They will not inhibit folic acid. They will directly inhibit the DNA synthesis. The direct inhibitors. In the direct inhibitors, quinolones are there. How many of you got it? Say yes. How many of you got it? Hannah? So there are direct and indirect inhibitors. Hannah? So there are total 3 drugs which are nucleic acids. So we will fill this master table and finish one more chapter. That is nucleic acid synthesis inhibitors. Hannah, they are previous one were protein synthesis inhibitors, and these are nucleic acid synthesis inhibitors. These two are indirect. This also inhibit folic acid. This also inhibit folic acid synthesis. Hannah, not directly DNA, and because of folic acid they inhibit DNA. This one directly inhibit DNA. So this one is direct inhibitor. These two are indirect inhibitor. Hannah, listen. First I will teach you these two together. Now listen. Sulfonamide and trimethoprim. Okay, listen. Sulfonamide and trimethoprim. See, how does folic acid is synthesized? Folic acid is synthesized from PABA, है ना? पैरा अमीनो बेंजोइक एसिड. पाबा, इसको पाबा ही बोलते हैं. पैरा अमीनो बेंजोइक एसिड. इट्स अ केमिकल. पैरा अमीनो बेंजोइक एसिड get converted into dihydrofolic acid, and dihydrofolic acid get converted into tetrahydrofolic acid, which is main folic acid. If I say folic acid, actually I'm talking about this folic acid. It's tetrahydrofolic acid. इसको प्यार से हम कहते हैं folic acid, है ना? And this one is required for DNA. This one is required for DNA synthesis, है ना? Now there are 2 steps. So for each step, one enzyme is required. For conversion of PABA to dihydrofolic acid, there is an enzyme. The name of enzyme there is an enzyme required. The name of enzyme is folate synthetase. FS, folate synthetase. And for the conversion of DHFA to THFA, dihydro to tetrahydrofolic acid, there is another enzyme, dihydrofolate reductase. Dihydrofolate reductase, है ना? So sulfonamides are inhibiting this enzyme, and trimethoprim inhibiting this enzyme. So ultimately, whether you say this or whether you say this, ultimately folic acid is not synthesized. And if folic acid is not synthesized, the DNA is not synthesized. So these two are indirect inhibitors of DNA. Say yes if you got it. Say yes. I will come on anti-malarials also, Sasika. It's included in the PPT if the time allows. Hana. After this, I am having anti-tubercular drugs, and after that, I am having certain more drugs, and then anti-malarial का भी number आएगा. ठीक है, let's see कितना कर पाते हैं, है ना? The clock is running, it's not stopping. Okay, the time is limited. I want to teach you everything, but the only limitation is the time. Okay, chalo. Listen. So please understand. So how does folic acid synthesized? Say. कैसे? Say ma'am, PABA. PABA पे क्वेश्चन आता है. PABA से क्या बनता है? PABA से बनता है dihydrofolic acid. Or what does dihydrofolic acid synthesize? It's tetrahydrofolic acid. है ना? 2 enzymes are required. Here folate synthetase, here dihydrofolate reductase. This is folate synthetase, this is folate reductase. Now sulfonamide inhibit this, trimethoprim inhibit this. So ultimately each of them, either this is absent or this is absent. Ultimately the summary is that folic acid will not form. If the folic acid is not formed, DNA will not form. So these two are indirect inhibitors of DNA. First thing you have to learn that. Now the second thing you have to learn is very important. We don't give them individual. We don't give individually sulfonamide. We don't individually give trimethoprim. We give them in combination. Combination will be the best. Now you can understand. This one will inhibit this enzyme. This one will inhibit this enzyme. So there is no chance the folic acid will be formed in the bacteria. We are talking about the bacteria. Bacteria में कोई chance नहीं है. If we are giving this alone, maybe by some alternate mechanism it is formed. If we are giving this alone, maybe by some alternate mechanism it is formed. So we give them in combination, and the combination of the two is known as cotrimoxazole. So what is cotrimoxazole? Say ma'am, cotrimoxazole. Cotrimoxazole is the combination of sulfonamide and trimethoprim. It's a combination. We give them in a combination. So the tablet available contains both, है ना? But they are given in a proportion of 5:1. है ना? So 5 milligram of this and 1 milligram of this. It's always given 5:1. So that after going in the body, this will also dissolve, this will also dissolve. It is not 100% the drugs are absorbed. After going in the body, their concentration will become 20:1. है ना? Because of different volume of distribution. Okay. So this 5:1 पे भी P by Q है. They are always given 5:1. What is 5 and what is 1? 5 is sulfonamide and 1 is trimethoprim. After going in the body, once they get absorbed, they will become 20:1. So in the tablet, they are 5:1, and after getting absorbed, it's 20:1. And the combination is known as cotrimoxazole. है ना? कॉट्रिमॉक्सोजोल का this brand name है Septron. Septron is the brand name. You know, like paracetamol, the brand name is Crocin. Crocin is a brand name. It contains paracetamol. In the same way, Septron is a brand name like Crocin. It contains cotrimoxazole. And just I'm telling you. Say yes if you got it. So we give them in combination. Say yes. Trimethoprim don't have any further classification. It is only one drug. But sulfonamides are of many types. You should know the classification of sulfonamide. They can be short acting, intermediate acting, long acting, topical. And this is the classification. Please read all classifications together. I'm not reading it. It will take time. Plus, please read it by yourself. Okay, can we go ahead? So please read the classification. Hana, trimethoprim don't have any classification. Now, the adverse effect of both of them is same. Hana, because we don't give them alone. We give, I'm sorry. Adverse effect of both of them is different. But uses of them is same. Because we don't give them alone. We give them together only. Hana? So adverse effect of sulfonamide, the mnemonic is ABC rash, which is our question right now. The mnemonic is ABC rash. So A stand for aplastic anemia. है ना B stand for bilirubin displacement. You know, bilirubin is displaced and the bilirubin, normally bilirubin, this is a blood vessel. This is bilirubin. Bilirubin bind with the albumin. Normally, है ना, this is conjugated bilirubin. It is bind with the albumin. Now, if you give sulfonamide, this is sulfonamide. Sulfonamide have more affinity for albumin. So ये जाके bilirubin को धक्का मारेगा. It will displace. कि तू हट मैं bind करूँगा. So it will push the sulfonamide and bind with the albumin. So basically the bilirubin get free. The bilirubin get free. So the free bilirubin will enter in the brain and damage the basal, damage the brain and it will cause the kernicterus. Basal ganglion in the brain. That is kernicterus. So this is bilirubin displacement that is causing kernicterus. Okay. C for crystaluria. That is our question right now. C for crystaluria. The crystal formation in the urine. Urine में crystals आएंगे. R for rash. है ना? A for acetylation. What were the drugs of acetylation? याद आया क्या? चिप्स ABC आज ही पढ़ाया है. चिप्स ABC का S क्या है? Sulfonamide. So it is metabolized by acetylation. You can correlate. S is SLE, है ना? And H is hemolysis in G6PD deficiency. So learn the adverse effect of sulfonamide. These are the adverse effect of trimethoprim. They are generalized. There is no mnemonic for that. And it causes vomiting, megaloblastic anemia, bone marrow toxicity, increased potassium in the blood and teratogenic. है ना? So you can learn. I will explain you. And the uses of both of them is same. Okay, the uses of both of them is same, that is Septron. The uses of both of them, because we give them in a combination, the cotrimoxazole. These are the uses of cotrimoxazole. This is the uses of cotrimoxazole. Cotrimoxazole ka brand name is Septron. So the mnemonic is also Septron. S stands for STDs. It is given in STDs, sexually transmitted disease. E for anthritis. है ना? P for Pneumocystis carinii and Pneumocystis jiroveri. You know, the fungus. T for typhoid. R for respiratory tract infection. A for acute UTI and N for nocardia. And just read the mnemonics. At least you will get something in the exam to do. So we are done with these two. Hana, please read it. Compare. Hana, out of the three, the two are done. How many of you got it? How many of you got it? I will provide the classification also, others, but not today. Maybe tomorrow or day after tomorrow. Hannah, I'm having back-to-back classes. I have to find the PDF where it is and I will definitely share with the team. Okay, but don't worry, I will share. Okay, listen. So sulfonamide and trimethoprim. You can see this is sulfonamide and this is trimethoprim. Quinolones I will teach you right now. First compare. Sulfonamide and trimethoprim. They are given in 5:1. Is pe PYQ hai? Learn it. In the blood, they will do 20:1. Because of different volume of distribution. What is 5 and what is 20 and what is 1? This is sulfonamide, this is trimethoprim. The combination is known as cotrimoxazole and they are synergistic. Hana, here we have a classification, here we don't have any classification. Spectrum is broad spectrum. Both of them are broad spectrum. This inhibit the enzyme. The name of the enzyme is folate synthetase. It's a PYQ. And this inhibit an enzyme. The name of the enzyme is dihydrofolate reductase. It is also a PYQ. So learn the name of enzyme. यहाँ पे folate synthetase है. यहाँ पे folate reductase है. This is inhibiting the first step. This is inhibiting the second step. You know, PABA to DHFA and here DHFA to THFA. You know the first and second step. Here the adverse effect is ABC of rash. I guess you know the full form. Here the adverse effect is nausea, vomiting, megaloblastic anemia, bone marrow toxicity, increased calcium and teratogenic. You can make some mnemonic. I don't have it. The uses of both of them is Septron. Anna, you know the Septron. STD, anthritis, Pneumocystis jiroveri, typhoid, RTI, Anna, respiratory tract infection, UTI and nocardia. It's very easy. Once you read it now, you will not forget. Say people, say. Bolo zara. You got it. You find it useful. Yes or no? Huh? Say something, people. Bolo zara. Kuch to bolo. Huh? Okay. So read your question and tell me the answer. If you got it, read the question. I'm asking you the side effect of sulfonamide. I guess reading this question, immediately the mnemonic should click in your mind. You should learn all the mnemonics very swiftly. Mnemonic click ho jana chahiye. Sulfonamide, what is the mnemonic? What is the mnemonic? The mnemonic is ABC of rash. ABC of rash. यही था ना mnemonic, ABC of rash. Let me confirm. ABC of rash. है ना? So what is coming in this mnemonic? C for crystalluria. It's coming here. Others are not coming. है ना? C for crystalluria. C is not for constipation. If you learn only mnemonic, if you don't learn the full form, है ना? So you will get confused in the exam. Got it? Okay. Can we go ahead? So crystalluria is the answer here. In this way, you will get maximum questions. It is not the thing you are going to get the question only on crystalluria. You can get question on any of the thing, either on sulfonamide or trimethoprim. It is a way I am teaching you. Pharmacology पढ़ना कैसे है boss? वो समझो, है ना? Pharmacology पढ़ने का तरीका ये है. Do you understand Hindi? How many of you don't understand Hindi? Huh? So this is a way to study pharma. You must understand the way. पढ़ाते तो सब हैं, सब कुछ books में दिया है. You have the notes, you have multiple apps, you have multiple subscription. I know that. This is a way I'm teaching you to learn the pharmacology. Make charts, understand it, learn it. Make your own mnemonics, maximum mnemonics, and learn that. Got it? Okay. So listen. So you can search me by MedLife by Dr. Priyanka. I'm available on all social media platform by this name. It's MedLife by Dr. Priyanka. Okay, you can ask your queries there. है ना? So I'm available on Instagram, Telegram, okay, YouTube, everywhere by this name. And you can ask your queries, whatever subjects I'm explaining you, I'm teaching you in NLC, है ना? Patho, Pharma, Micro, PSM. You can ask your doubts there, whatever your doubts are there. Okay, so let's go ahead. Can we go ahead? Chalo. So coming on the next question, in the form of the question, we will see the quinolones. Okay, read the question first. Then we will see all about the quinolones now, fluoroquinolones. Okay, which of the following fluoroquinolone has the broadest spectrum? Is it ciproflox, norflox, trovaflox, or nalidixic acid? They all are quinolones. Quinolones are floxacenes. There are fluoroquinolones. These all are floxacenes. What is the correct answer? Okay, what is the correct answer? First you guess, then I will tell you the answer. The correct answer is C. I will show you the question again. Don't worry. Let me explain you everything about this quinolones, the third category. I will explain you everything. In the end, I will show you this chart and we will see, compare everything. So let's come on the quinolones. Quinolones are also nucleic acid synthesis inhibitor, but they will directly inhibit the DNA. They will not indirectly inhibit. These two were inhibiting the DNA synthesis indirectly by inhibiting the folic acid. But this one, quinolone, directly inhibit the DNA synthesis. It will not inhibit folic acid. So let me tell you how many types of quinolones are there. Quinolones are of 4 types. First generation, second generation, third generation, and fourth generation. What do you mean by that? First, second, third, fourth. First generation act only for gram-negative bacteria, not for gram-positive. It's very narrow spectrum. Only 2 first generation are there, nalidixic acid and oxaloic acid. We don't use them nowadays because it is having narrow spectrum. It acts only for gram-negative, few gram-negative bacteria. है ना? Second generation also act only for gram negative, but many gram negative. This one is for few gram negative. This one is for maximum gram negative. है ना? So better than the last one. So here we are having 4 drugs: Norflox, Lomeflox, Ciproflox, and Oflox. है ना? You can make some mnemonic and learn. Norflox, Lomeflox, Ciproflox, and Oflox. है ना? So these are the 4 drugs in the second generation. The third generation, along with gram negative, they cover gram positive also. So these are best one, better one, you can say. So here we are having 7-8 drugs: Levoflox, Sparflox, Getiflox, Pflox, Tamiflox, Tosuflox, and Moxiflox. Make some mnemonic and learn, or at least read the names. So these are third generation, and fourth generation are the best one. They act for all gram positive, they act for all gram negative, and they act for anaerobes also. है ना? So all gram positive, all gram negative, and anaerobic bacteria, the best, the broadest spectrum. So और कुछ learn करो ना करो, you have to learn the fourth generation. If you want to learn third and second also, it's good. If you can't learn, it's okay, but learn the fourth one. You can't skip the fourth one. So the mnemonic you can make: Trovaflox, Fleroflox, Gamiflox, Truliflox, Sitaflox, and Clinaflox. है ना? Now read your question. They are asking the broadest spectrum. So basically they are asking you the 4th generation fluoroquinolones. So if you can learn all, it's good. If you can't learn all, at least learn the 4th. So nalidixic acid belongs to first category. Norflox and Ciproflox belong to second generation. Trovaflox belong to the 4th generation. You can see Trova is coming in the 4th generation. So my answer is Trova. How many of you got it? Say yes if you got it. Can we go ahead? So learn the classification. पहली चीज है भाई classification learn करो. बार बार एक ही चीज बोल रही हूँ. Pharma is nothing without classification. If you don't know classification of all the drugs, and if you are learning pharma, trying to understand the pharma, you are still at zero. There is no use. You will get any drug in your exam, your question. You don't even understand the name of the drug, to which category it's belong. है ना, तुम्हें उसका अता पता ठिकाना ही नहीं पता, तो क्या आंसर करोगे, कौन सा निमोनिक लगा लोगे, है ना. सो फर्स्ट प्लीज लर्न द क्लासिफिकेशन, है ना. दिस इज द वे. लर्न ऑल क्लासिफिकेशन, लर्न द टेबल्स. द फार्मा इज डन. इट्स वेरी इजी, इट्स वेरी इजी, है ना. चलो, व्हाट इज द मैकेनिज्म ऑफ एक्शन. अच्छा, हाउ डज डीएनए सिंथेसिस, डीएनए रिप्लिकेशन टेक्स प्लेस. लिसन, this is the bacteria, this is the nucleus of the bacteria, these are the two strands of the DNA, the double-stranded DNA. How does DNA replicate? Have you read it in biochemistry? Say yes, ma'am. The two strands separate from each other. One is leading, one is lagging. Hana, one is leading, one is lagging. Then the enzyme will come. Hana, the enzyme is DNA polymerase, and it will do the replication here also. It will do the replication here also. Hana, on DNA, on leading. But my point is that who does the separation of the leading and lagging? Who does the separation of the leading and lagging? Who does the separation? It is known as unwinding. Separation of the two strands. You can see here in the diagram. You can see here in the diagram. Let me show you what I mean. You can see this is the double-stranded DNA. Let me change the color. You can see this is the double-stranded DNA. So there is an enzyme which is separating the two strands. One is leading, one is lagging. One is leading, one is. Then only replication occurs here also, and replication occurs here also. With the help of DNA polymerase. But name this enzyme. I'm interested in this one. Which enzyme is doing the unwinding? Without unwinding, you cannot replicate the DNA. Who is doing the unwinding? So unwinding is done by DNA gyrase. By DNA gyrase. The name of the enzyme is DNA gyrase, and fluoroquinolones inhibit DNA gyrase. So if the fluoroquinolone is there, this is DNA gyrase in gram negative bacteria and topoisomerase. है ना, इसी का इक्विवेलेंट है टोपोआइसोमरेज 4 in gram positive bacteria. So fluoroquinolones inhibit both. Now listen, this is the bacteria. I want to kill it because it is causing disease in my patient. This bacteria is present in my patient and causing a disease. I want to kill it. I want to kill it. So I am giving a drug which is known as fluoroquinolone. First generation, second generation, third, best is the fourth one. If you are giving any of the fluoroquinolone, first, second, third, fourth, कोई भी दे रहे हो, the fluoroquinolone will enter inside the bacteria. It will enter inside the nucleus. है ना? Now when the DNA try to do the unwinding, the DNA tried to do the unwinding, the leading and lagging, there is an enzyme required. The name of the enzyme is DNA gyrase or topoisomerase. This fluoroquinolone inhibit the enzyme. Inhibit this enzyme. Either DNA gyrase or topoisomerase. DNA gyrase or topoisomerase is inhibited. So the unwinding cannot be done. The two strands cannot separate with each other. These are the two strands. They cannot separate because the enzyme which do the unwinding is inhibited. Since they cannot separate it, DNA replication cannot take place. DNA cannot be replicated. It is a direct inhibitor. It is not inhibiting indirectly by inhibiting folic acid, like sulfonamide, like trimethoprim. It is a direct inhibitor. Say yes, say yes. So it is inhibiting the unwinding. No unwinding, no replication. So basically, fluoroquinolones inhibit the enzyme. Which enzyme? Which enzyme? Either DNA gyrase or topoisomerase in gram positive and gram negative. Topoisomerase. Topoisomerase. Say yes if you got it. So please learn the mechanism of action. Got it? What are the adverse effects? Adverse effects are non-specific. I don't have any mnemonic here. It causes adverse effects on the GIT, most common, that is nausea and vomiting. In the CNS, patient have dizziness. Bones and soft tissue, it causes tendon rupture. That's why it is contraindicated in children. Phototoxicity in the skin. Torsades de pointis in the heart. You know what is torsades de pointis? PQRST में QT interval is prolonged. That is known as torsades de pointis. You may have read this in medicine. And teratogenic. Never give any of the fluoroquinolone to any of the pregnant lady. It is teratogenic. So these are the 6. You can make some mnemonic. The uses is 4G spectrum CT. 4G spectrum CT. This is the mnemonic. There are 4G. It is the first choice in gonorrhea, gastroenteritis, gynecological infection, and gram-negative bacteria. G. S is septicemia. P is prophylaxis. It is given prophylaxis before surgery. I'm going to perform a surgery on my patient. So before that, I will give the antibiotic so that during the surgery or after the surgery, post-op, patient don't have infection. So prophylaxis before surgery, we use this one. We give the fluoroquinolones as a prophylaxis before surgery. E is enterocolitis. C is chancroid, T is typhoid, R is RTI, respiratory tract infection, U is UTI, urinary tract infection, M is meningitis, conjunctivitis, and tuberculosis. Basically, these are broad spectrum now. 4th generation include everything. It includes gram positive also, gram negative also. It includes anaerob also. So that's why the spectrum is very big. Basically, it is given everywhere. कुछ नहीं समझ रहा, कोई भी fluoroquinolone दे दो. हाँ, you have diarrhea, you take Norflox. हाँ, you have some fever or bacterial infection, tonsillitis, you take Oflox. Huh? You take Norflox, you take manifloxacin, no? You take or you prescribe to your patient. Say yes. Got it? Huh? Say yes. Can we go ahead? So this is the summary. We are done with one more chapter. We are done, but it took time, I guess. Hai We are done with more chapter. So these are the 3 drugs which inhibit nucleic acid inside the bacteria. So this is the bacteria, this is the nucleus of the bacteria, this is the double-stranded DNA inside the bacteria. You want to inhibit the DNA synthesis. So 3 options you are having. You can do it with sulfonamide, trimethoprim or quinolones. Quinolones are fluoroquinolones. But from these 3, these 2 are indirect inhibitor because they inhibit the folic acid. They both inhibit the folic acid. No folic acid, no DNA. These are indirect. And fluoroquinolone, it is a direct inhibitor. It inhibits the unwinding wala step by inhibiting DNA gyrase or topoisomerase. Now, see. Don't learn the structure. You can skip the structure. Skip it. Classification here, Here there is no classification. Here, first generation, second generation, third generation, fourth. If you can't learn all, learn fourth. Learn fourth. First, nalidixic acid and oxynolic acid is there. Learn first and fourth. Don't learn second and third if you can't learn. Okay. Spectrum, this is broad spectrum. This is broad spectrum. Here, spectrum differs. In first generation, only gram negative. In second generation, extended gram negative. In third generation, with gram negative, there is gram positive also. In fourth generation, gram negative, gram positive with anaerobes. I told you, spectrum pe bhi bahut questions aate hain. Now, see the mechanism of action. See, it's very important to see the mechanism of action. Sulfonamide inhibit folate synthetase enzyme. Folate synthetase enzyme, so no folic acid synthesis. And trimethoprim inhibit folate reductase enzyme, dihydrofolate reductase. So again, no folic acid synthesis. That's why they are given in combination 20:1 or 5:1. The action is synergistic. It's also a PYQ. But here the mechanism of action is something different. It inhibits the unwinding wala step by either inhibiting DNA gyrase or topoisomerase. In gram positive or gram negative bacteria. Learn both enzyme. Now see the adverse effect of all of them. Here the adverse effect is ABC of fresh. You get many questions on that, especially on crystalluria and kernicterus. Bilirubin displacement causing kernicterus. In pe bahut question aate hain. Here there is no mnemonic I am having. Here there is no mnemonic I am having. But here torsitis D pointers pe question aate hain. Torsitis D pointers you have to learn here. Uses is very easy. Very easy uses. Here the use is septron. Here also the use is septron because they are given in combination. So use the same. Here the use is 4G spectrum CT. I wish if I had time, I say the full form again. But I am not saying it because time is limited. The clock is running. Can we go ahead? Can we go ahead? Say yes if you can go ahead. So coming on the next question, the next chapter, the next topic. The next question, the DOTS regimen, the anti-tubercular drugs. We will cover them quickly and you frequently get questions on that. So read the question and tell me answer. Which of the following anti-tubercular drug can precipitate gout? What is the correct answer? Can you tell me what is the correct answer? Please be fast. What is the correct answer? Is it pyrazinamide? Is it rifampicin? Is it streptomycin? Or is it isoniazid? Can you guess? So let's go ahead and I will show you the question again. Instead of wasting time, let me explain you and then I will come on the question again and you will be able to answer. So TB is the disease, it is a chronic granulomatous inflammation. It is caused by a bacteria. The name of the bacteria is Mycobacterium tuberculosis. We know that, Mycobacterium tuberculosis. So I am right now teaching you anti-tubercular drugs. Anti-tubercular drugs which kill this bacteria, the Mycobacterium tuberculosis. So there are 5 first-line drugs. Please learn, you are getting very frequent questions. You get very frequent questions from this topic. So there are 5 first line drugs. The 5, I'm sorry, this classification is wrongly placed. Okay, I will tell you, don't worry, this classification is wrong. There are 5 first line drugs. What are the 5 first line drugs? Isoniazid, rifampicin, HR, pyrazinamide, Z, ethambutol, E, and streptomycin, S. H is isoniazid. If you don't know, isoniazid, niazid is expressed by H. R is rifampicin. Z is pyrazinamide. E is ethambutol. And S is streptomycin. Please learn. These are the 5 first line drugs to kill the bacteria Mycobacterium tuberculosis, and these are the 5 first line drugs, anti-tubercular drugs. HRZES. Please learn HRZES. है ना? These are fine. Along with that, we have many second line also, but main are first line drugs HRZES. So I want you to learn the introduction, mechanism of action, resistance, pharmacokinetics, and adverse effect. Use I'm not telling you because these all are anti-tubercular drugs. So use is TB, 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 TB. Anna, so use, there is no use for to learn the use. But adverse effect is very unique. You have to learn the adverse effect and mainly mechanism of action of each of them. So let's start them one by one. Okay, before starting one by one, let me explain you something. HR, don't change the sequence. Learn them in a sequence. HRZES. Say the full form. Say the full form. Isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin. Streptomycin is one of the aminoglycoside. Anna. So learn, don't change the sequence, otherwise you will get confused. Out of them, they all are Sidal. They kill the bacteria, except ethambutol, which is static. It do not kill the bacteria. It do not kill the bacteria. It inhibit the growth of the bacteria. So that is static. Hana, that is ethambutol is static. Only ethambutol is static, rest all are Sidal. So this is Sidal. Ethambutol is static, it's a PYQ. Please learn that. Please learn that. Now, this is the lung, inside which, Hana, this is the lung. These are the cells of the lung, the alveolar cells. Imagine, Hana. So where is the TB bacteria is there? Mycobacterium tuberculosis kahan pe hota hai? It is present intracellular also and it is present extracellular also. So Mycobacterium tuberculosis is intracellular also, extracellular also. So some of them kill only intracellular wala. Some of them kill only extracellular, some of them kill both. You got my point? So among them, isoniazid kill both, intra and extra, both the bacteria, intracellular, extracellular. Rifampicin also kill both, and ethambutol also kill both. But pyrazinamide kill only intra, it's a PYQ, and streptomycin kill only extra. These all are your PYQs. Say yes if you got it. Huh? Say yes. Can we go ahead? Huh? So that is the bacteria, the action on the bacteria they have. Now listen. How to kill that? Let me explain you mechanism of action of all five. This is Mycobacterium tuberculosis. This is the nucleus. This is Mycobacterium tuberculosis bacteria. It is having a cell wall. All bacteria have a cell wall. But inside the cell wall, it is having something unique which is known as mycolic acid. And a mycolic acid is required for the cell wall. If mycolic acid is not there, cell wall will be not there and the bacteria will burst and die. Hana? So how does mycolic acid synthesized? How does this mycolic acid or cell wall is synthesized? Hana? For which three enzymes, three enzymes are required, So mycolic acid and arabinogalactan, they both combine together and they form the cell wall. And I don't learn that, just understand. Three enzymes are required. FAS1, FAS2, FAS is fatty acid synthetase 1, fatty acid synthetase 2, and arabinosyl transferase. These are the three enzymes required and ultimately it forms the cell wall. Hana? If you want the cell wall, these three enzymes are present in the bacteria. Now I'm teaching you the five drugs, na HRZES. H, that is isoniazid, inhibit FAS1. Inhibit FAS1. No FAS1, no cell wall. Hana? HRZ, Z inhibit FAS2. Hana? No FAS2, no cell wall, the bacteria will die. Hana? HRZE, E inhibit arabinosyl transferase. Hana? By mistake, this should be yellow. Hana? So arabinosyl transferase. So again, no arabinosyl transferase, no cell wall. So out of the three mechanisms I told you. है ना, three mechanism. कौन बच गया? R and S. See. I'm drawing the bacteria. This is Mycobacterium tuberculosis. है ना? This is Mycobacterium tuberculosis. ठीक है? This is the bacteria, Mycobacterium. Please understand the mechanism of action of all five. है ना? In the next 10-20 minutes, I will finish this. All five drugs. Listen. And this is the cell wall. This is the cell wall. Okay. So the five drugs. Out of the three inhibit cell wall synthesis. H, Z, and E. They inhibit cell wall synthesis. H inhibits cell wall synthesis by inhibiting the enzyme FAS1. Z inhibit by inhibiting the enzyme FAS2. And E inhibit the enzyme arabinosyl galactosidase. No FAS1, no FAS2 or no arabinosyl galactosidase. If any of them is missing, cell wall is not there. Mycolic acid is not there and the bacteria will burst and die. Say yes, three of them. Now one of them, that is R, rifampicin, R for R. It inhibits RNA. Rifampicin inhibit RNA synthesis. So from the DNA, RNA is synthesized. The two strands of the DNA separate from each other. You can see the two strands of the DNA. My pen is not working. It's giving trouble. Give me a minute. My pen got stuck. So the two strands of the DNA get separated. Now on the leading strand, the mRNA is formed. From DNA to mRNA is formed. No? So the enzyme required for the conversion of DNA to mRNA. The name of that enzyme is DNA-dependent RNA polymerase. What is the name? DNA-dependent. It is dependent on DNA and RNA polymerase. DNA-dependent RNA polymerase. So rifampicin inhibit this enzyme. No DNA-dependent RNA polymerase, no RNA. So rifampicin is inhibiting RNA. R for R. It inhibits RNA. No RNA, the bacteria will die. The bacteria will die. That is the fourth one. And the fifth one, the streptomycin, you already know. Streptomycin is an aminoglycoside that act on the ribosome and inhibit the initiation, the first step of the initiation. So streptomycin is inhibiting the protein synthesis. So the 5 drugs mechanism of action I told you. Say yes if you got it. How many of you got it? So can you say it again, once again? So what is the mechanism of action of all 5? This is the bacteria. The name of the bacteria is Mycobacterium tuberculosis. This is a TB bacteria. Okay. This is the nucleus of the bacteria. This is the ribosome in the bacteria. This is the double-stranded DNA in the bacteria. And this is the cell wall in the bacteria. So there are 5 drugs, H, R, Z, E, S. Which one is, what is the mechanism of action of each of them? H, Z, and H, R, Z, E. E. It is inhibiting the cell wall by inhibiting different enzyme. This one inhibit FAST1, this one inhibit FAST2, and this one inhibit arabinosyl glycosides. So no FAST1, no FAST2, no arabinosyl glycoside. So cell wall will be absent. No cell wall, the bacteria will die. Hana. The next one, rifampicin, R for R. Rifampicin inhibit RNA synthesis. R for R by inhibiting an enzyme. Here also we have enzyme. The name of enzyme is DNA dependent RNA polymerase. Reverse bhi aata hai option mein. RNA dependent DNA polymerase. No, it is not there. DNA dependent RNA polymerase. Hana. And the last one, streptomycin, act on the ribosome and inhibit the initiation portion here. It bind with 30S also, 50S also, both also. I have told you everything. Everyone give me a thumbs up. So I told you the mechanism of action of all 5 at one place. है ना, mechanism of action of all 5 at one place. इससे easy क्या बताऊं? This one inhibits cell wall. This one also inhibits cell wall. This one also inhibits cell wall by different enzyme. R for R. This one inhibit RNA. By inhibiting the enzyme DNA dependent RNA polymerase. And this one inhibit protein. Inhibit cell wall, inhibit RNA, inhibit cell wall, inhibit cell wall, inhibit protein. And you know the enzyme in all of them. Give me a thumbs up. Say yes. Got it. Mechanism of action is done. Introduction mein I told you they all are Sidal, except ethambutol which is static. Ye learn karna hai na? You have to learn this. Listen. One more thing in the introduction I told you. This kill both intra and extra. Intracellular and extracellular bacteria. This kill only extra, this kill only intra, and this also kill both. So you have to learn that. है ना, ये introduction भी बता दिया मैंने. So I told you the introduction, I told you the mechanism of action. The main thing which I have to teach you right now is the adverse effect of all 5. So one by one we will see. Let's start with isoniazid. I told you this one is Sidal. I told you it kill both intra and extra. It is a drug of choice for TB out of the 5. It is a drug of choice for prophylaxis of TB. For treatment of TB and prophylaxis of TB, the drug of choice for both of them is isoniazid. Got it. So this is the thing. And it inhibits FAST2. I'm sorry, I said reverse. Isoniazid inhibit FAST2 and pyrazinamide inhibit FAST1. I have said reverse by mistake. Hana, this is FAST2. And the side effects. Hana, allergies everywhere. Don't learn allergy. Hypersensitivity, allergy is everywhere. Hana. Now you have to learn the first 3 drugs causes hepatitis. HRZ. देखो ये भी था यहाँ पे. See, the first 3 are causing hepatitis. Hepatitis is caused by H also, R also, Z also, but maximum is Z. Hepatitis. So hepatitis is here also, here also, here also. So one of the side effect is hepatitis. But the main side effect you have to understand here, it causes deficiency of vitamin B6. That is pyridoxal phosphate. है ना, pyridoxal phosphate. That's why it will cause neuritis. That's why it causes neuritis. Say yes. That's why it causes neuritis. है ना, peripheral neuritis. So don't learn allergy. Allergy is everywhere now. So don't learn. Learn the 2 specific. One is hepatitis. One is neuritis. Peripheral neuritis because of deficiency of vitamin B6. Coming on the rifampicin. It is also bactericidal. It also kills both intra and extra. It is the most potent among the 5. The drug of choice is H, but the most potent is rifampicin. Most potent. It's a question. Most potent is rifampicin. You can see it is also Sidal. It also kills both. It also causes hepatitis. And what is the mechanism of action? It inhibits RNA synthesis by inhibiting an enzyme DNA dependent RNA polymerase. It is not RNA dependent DNA polymerase. Please mind my words. Because for synthesis, you want to convert this as double-stranded DNA. First, the 2 strands of the DNA will separate. One will be leading strand, one will be lagging. The 2 strands are separated. Now, you want to create RNA, synthesize RNA from DNA. So, which enzyme you require? The name of the enzyme is DNA-dependent RNA polymerase. It is synthesizing RNA from the DNA. So, this enzyme is inhibited. This enzyme, the RNA will not synthesize from DNA. No RNA synthesis. R for R. Rifampicin inhibit RNA. Learn like that. I have told you. The side effects. Side effects mein hepatitis is there. In the first 3 drugs it is there. Maximum in Z. Here also hepatitis. but here the urine and all the secretion become red, है ना. Patient cry, the tears will be red. वो कहता है खून के आंसू रो रहा हूँ, वो सच में खून के आंसू. It is not red, actually it is a color red, it is not blood. So patient get afraid, oh my god, I am having blood in my tears. No. So warn the patient, you are taking the drug, maybe you are having the tears. If the patient wears the contact lens will become orange or red in color. So ask the patient to don't wear the contact lens, wear spectacles, है ना. So it's also a question. ठीक है. Number 1, the urine will become red or orange. The patient will get afraid, oh my god, my urine is red or orange. So warn the patient, it's okay if you have it, don't get afraid. The saliva will get, this vaginal secretion, all the secretions will get red or orange in the body, है ना. So red or orange you have to learn here rifampicin में, ठीक है. And hepatitis is there. That's it. These are the important things here you have to learn, है ना. Pyrazinamide, the third one, it's also Sidal, है ना. It acts only for intracellular, not for both. I told you this one is acting only for intracellular, this one is also Sidal. And here also hepatitis is there, maximum. What is the mechanism of action? It inhibit FAS1, है ना, and inhibit the cell wall synthesis. ठीक है. This is also hepatitis, but maximum hepatitis. Along with maximum hepatitis, it cause urate excretion. It decreases uric acid excretion. So uric acid accumulation will be there. That will lead to gout. So gout is something unique. है ना. Gout is something unique here. The next is the ethambutol. This one is only static. Rest all are Sidal. This one is only static. इस पे question आता है. Please learn. This one is only static. What is the mechanism of action? It inhibit arabinosyl transferase. है ना. The H was inhibiting this. The Z was inhibiting this, and E is inhibiting this. Ultimately, this or this cell wall will not form. If the cell wall will not form, the bacteria will burst and die. Say yes. Side effect. Here, the main side effect is optic neuritis. The patient will have color blindness, है ना. Never give it in, if you are giving it in some driver or pilot, ask them to leave their job because they will have color blindness. It's reversible. Although it's reversible, it's never given in the children. As soon as the color blindness develop, we stop the drug, है ना. So it's reversible. Here also gout is there. I will enumerate in the end, don't worry. And last is streptomycin, है ना. It is a streptomycin. It is the first drug to be discovered, anti-tubercular drug. Nowadays, it is shifted to the second line. It is also Sidal and it kills only extracellular. I told you it kills only extracellular. It's also Sidal. है ना. You know the mechanism of action? It binds on the ribosome, 30S, 50S and both, and inhibit the initiation, the first step. So that's why it inhibit the protein synthesis, है ना, the protein synthesis. The side effects also you know on HT. On HT, I have told you if you are attending my lecture from the beginning. Got it? So I am filling this table in front of you. Please help me to fill that. Listen. Where is that table? Yeah, this one. I want to fill it with you. So we are done with this chapter also. We will be moving on the next chapter quickly. Chalo. One more chapter we can do, I guess. Chalo. So anti-TB drugs are done and you get many questions out of that. Can we fill it together? I don't have the filled version. We will fill it together. Can we? Huh? Yes. Please come, everyone. We will try. So here write down Sidal, except ethambutol, which is static. The first thing. ठीक है. This one kills both intra and extra. This one also kill both intra and extra. Ethambutol also kill both intra and extra. Pyrazinamide killed only extracellular, and streptomycin kill only intracellular. Don't change the sequence. First thing, learn the sequence HRZES. Don't dare to change it. Everything will get confused. Okay. Tell me the mechanism of action of all five. Chalo. Say, huh? Inhibit cell wall synthesis. Inhibit cell wall synthesis by inhibiting certain enzyme. Here the enzyme which is inhibited is FAS2. Here the enzyme which is inhibited is FAS1. And here the enzyme which is inhibited is arabinosyl galactosidase. But ultimately cell wall is inhibited. Here RNA is inhibited, R for R. The name of the enzyme is DNA dependent RNA polymerase. You have to learn the name of enzyme also. And here protein is inhibited. है ना, protein synthesis. No enzyme, but it inhibits the initiation wala step. The first step, initiation by binding on 50S, 30S both. Got it? So this is in short the mechanism of action of all five. Coming on the adverse effect directly. Come. Fast. Coming on the adverse effect. Directly I'm coming on the adverse effect. So see, allergy is everywhere. I'm telling you the specific one. Hepatitis. Here +1. Here +2. Here +3. So maximum hepatitis is here. Don't change the sequence. Gout is here and here. है So third one is having hepatitis and gout both. That is pyrazinamide. है So hepatitis in the first three, gout in the third and the fourth. है Here one more extra thing is peripheral neuritis. Because of deficiency of B6. है Paradoxal. ठीक है. Here one more extra thing you have orange urine, orange everything. है Here one more extra thing, nothing you have. Here one more extra thing is optic neuritis. Optic neuritis. And here you have ON-HT. You know the full form of ON-HT? Ototoxic, nephrotoxic, neurotoxic, allergies everywhere, hypersensitivity, and teratogenic. This is the simplest and the easiest way I can summarize for you. You get maximum questions either on mechanism of action, or on side effect, or on the static signal, or intra-extra. One more thing I forgot to tell you. Which is the drug of choice for TB? H. Which is the drug of choice for prophylaxis of TB? Again H. But which is most potent? The most potent is rifampicin. It is also a question. So maximum questions I am trying to cover. ठीक है जी, got it, say yes. So give me a minute, let's move on the give me a minute, let me show you few more questions. You want to solve this question, you can solve it later on. It's very easy. So let's come on the next topic quickly and end this session. Okay, one more chapter I can cover. I'm having 10 more minutes, 10 or 15 more minutes. Chalo. The next question is in front of you. The next chapter we are going to cover is the ACE inhibitors. Chalo, quick. Enalapril is contraindicated in all of the following except. I'm asking for pril, one of the pril. Enalapril is one of the pril. It is an ACE inhibitor. What is the correct answer? Is it diabetic nephropathy, single kidney, bilateral renal stenosis, or hyperkalemia? What is the correct answer? I will come on the question again. The correct answer is diabetic nephropathy with albuminemia. I will give you a mnemonic, the PAR. Let me explain you everything about the ACE inhibitors. Let's start ACE inhibitors. ACE inhibitors, there are total 7 or 8 drugs. The mnemonic, the suffix is pril. It is captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinopril, terindolopril. Don't add pril after your name. You have to learn the name of the drugs. So please learn the name of your drugs. The suffix is pril. With the help of the pril, you can identify it's an ACE inhibitor. So the suffix is pril. Now the most important thing here, I told you, they all are prodrugs. You know what is the prodrug? They all are inactive. After going in the body, in the liver, they convert into active form. They all are prodrug except two. I've told you the exception is first question or second question tha hamara. So the two exception is captopril and lisinopril. These are not prodrug. These are directly active. Captopril and lisinopril. Rest all are prodrug except captopril and lisinopril. It's a very important question. We have already seen. Okay. Can we go ahead? So learn the name. This is the classification. Again, the same thing. Classification, mechanism of action, adverse effect, uses, contraindication. That's it. Contraindication कहीं होते हैं. ठीक है. So that's it. वही 4-5 heading में पूरा pharma चलेगा जी. Got it. So classification is done. We are reading a chapter ACE inhibitor. What is the mechanism of action? Listen. What is the mechanism of action? You have to understand. Imagine, what is the normal blood pressure? The normal blood pressure is 120/80. We all have this blood pressure. Normally, you are having more or less, plus minus. This is the normal blood pressure. Got it? Now imagine by any reason if the blood pressure is less. For example, if I'm lying down in the morning, if I suddenly wake up, like from supine position to erect position, suddenly. So, all the blood will go in the legs. If I suddenly wake up, so we will feel a little bit vertigo. You may have felt it. If you are waking up suddenly, you may feel like dizziness. That is blood pressure is fault a little bit. But again, it is maintained. If I have vomiting, if I have diarrhea, if I have an accident, if I have a surgery, blood loss is there. So by any reason, if the blood loss is there, any reason the blood pressure is fault, God has given a backup. God is great now. So God has given a backup to maintain the blood pressure again. What is that backup? The backup is known as renin-angiotensinogen pathway. What is that renin-angiotensinogen pathway? Renin-angiotensinogen system, RAS, renin-angiotensinogen system. What do you mean by that? So listen, this is the blood vessel. Can you all see the blood vessel? Say yes. Inside the blood vessel, there is a protein known as angiotensinogen. It is a name of protein. It is synthesized by liver. Liver synthesizes this protein. It is present in you. It is present in me. Currently also in all of our blood, this is present. But it is inactive. Now, whenever there is a fall in blood pressure, at that time, kidney will get less blood. Kidney is the most sensitive organ. If the blood pressure is 120/80, so kidney is getting normal blood. If the blood pressure is less than 120/80, and I have vomiting, I have diarrhea, I have accident, I have surgery, my blood pressure is not 120/80. So all the organs will get less blood, but kidney is very sensitive. जैसे ही उसको कम blood मिला, as soon as the kidney get less blood, kidney समझ जाएगी that blood pressure have fault, and kidney form an enzyme. The name of the enzyme is renin. So renin is not present in my blood right now because my blood pressure is 120/80. But by any reason, if my blood pressure is less than that, then only renin will come in the blood. Otherwise, renin is not present in the blood. So renin will come within seconds in the blood. Few seconds it will come. As soon as your blood pressure falls, the moment it will come. है ना, renin convert angiotensinogen into angiotensin 1. And again from the lungs another enzyme will come. The name of that enzyme is ACE, angiotensin converting enzyme. ACE, it convert angiotensin 1 to angiotensin 2. That's why known as angiotensin converting enzyme. It is converting angiotensin 1 to angiotensin 2. This angiotensin 2 act on the 6 organs and maintain the BP again. It acts on the blood vessel, causes vasoconstriction. It acts on the heart. It acts on the adrenal. It acts on the kidney. It acts on the brain, increases the thirst. So it maintain the BP again. So this is the normal mechanism. How many of you got it? Say yes. Say yes. So you can understand there is a protein, angiotensinogen, which is secreted by the liver. And there are two enzymes back to back they will come. The first enzyme is the renin. It is coming from the kidney. And the second enzyme is the ACE. It is coming from the lung. So both enzymes are required. We require renin also. We require ACE also. Then only angiotensin 2 will be formed. And angiotensin 2 will maintain the BP. If you want to maintain your BP again, just suppose I have vomiting and my BP have fallen. I am dehydrated. So my BP will come again if I have angiotensin. But angiotensin banne ke liye I need two enzymes. Renin from the kidney and ACE from the lung. So yes, ma'am, it's very good. God is great and God has given this backup in all of us. We are unaware. So if I get up, I have postural hypertension. I feel vertigo in the morning a little bit. Within a fraction of second, my BP is settled again. I don't worry. Because this system is activating in all of us. It is an inbuilt system. You will say, ma'am, then what is the problem? What's the problem? The problem is that in old age, after 50s or 60s, this system, renin angiotensinogen system, it's a family having 3 protein, 1, 2, 3 and 2 enzymes. Total 5 members are there. 3 are protein, angiotensinogen, angiotensin 1, angiotensin 2. These are the proteins and there are 2 enzymes, renin and ACE. The family is known as RASki family. RASki family, it is required for maintaining BP. It is inbuilt in all of us. But in old age, the RAS is hyperactive. When the blood pressure is normal also it become active. Normally it should get activated only when the blood pressure is falling. But in old age, it is hyperactive. It is more sensitive. So at normal pressure also, the renin and ACE will come in the blood. My blood, when I'm not 50, but when I will cross my 50s and 60s, in old age, our parents or grandparents, so in them the blood pressure is normal. So normally renin and ACE should not come, but renin and ACE come in their blood. It is hyperactive system. So they have normal BP, but once angiotensin 2 will be formed, it will increase the BP. So if the BP is less, it will increase and maintain it. But if the BP is already normal, it will elevate the BP. That's why in old age the person have hypertension. The person have hypertension. You may have seen how many of you, the parents and the grandparents are hypertensive. Most of us. My parents, my grandparents, they all are hypertensive. Most of us, 80 to 90% people in old age are hypertensive. This is primary hypertension. This is the reason. Because in old age, the RAS is hyperactive. So what is the treatment? You are a doctor, na? Imagine a patient is coming, doctor, headache ho raha hai, 2-4 din se bhari lag raha hai, अच्छा नहीं लग रहा है, गर्मी सी लग रही है. These are the symptoms in the hypertension. If you measure the blood pressure or, you are measuring it incidentally, blood pressure, and you found, oh my God, you are hypertensive, your blood pressure is 140/90, 140/100, 150/100, something like that. And you are measuring repeatedly on 2-3 days and it is the same. So person is hypertensive. The person is old, more than 50-60. You want to treat it. What you will do? You will say, ma'am, I want to treat it. So I will treat the cause. Kisne kiya hypertension here? The hypertension is caused by this family, the RAS family. This family is causing the hypertension. So you give a drug. The name of the drug is ACE inhibitor to treat the hypertension. You give a drug, ACE inhibitor. So ACE inhibitor are the drug which inhibit ACE enzyme. No ACE enzyme, angiotensin 2 will not form. Angiotensin will not form, so BP will fall again and it will become normal, the hypertensive BP will become normal. Say yes if you got it. These are the concepts. No one teaches you like the conceptual pharmacology I teach. The people teach you like, just rato. Jahan samajhna hai, samjho. I'm not saying कि pharmacology में सब समझना है. रटना है. जहाँ रटना है, I will give you the mnemonic. ठीक है, लेकिन जहाँ समझना है वहाँ समझो. Say yes, people. जल्दी बोलो जरा. Got it. So this is the ACE inhibitor. So what is the mechanism of action? Say. So normally whenever we have fall in BP, the angiotensinogen, it is present in our blood. Currently also we have this. It is secreted by the liver. ये हमेशा रहता है. But as soon as the BP fall, the kidney secrete the renin. Renin convert angiotensinogen to angiotensin 1 and the lungs secrete the ACE. Angiotensin 1 converted into 2 and 2 will maintain the BP again. But in old age, it is hyperactive. In old age, it is hyperactive. Say yes, in old age, it is hyperactive. So you can see, acha. In the lungs, what is the name of the enzyme in the lung? In the lung, it's ACE. What is ACE is doing? What ACE is doing? I'm asking you, what ACE is doing? ACE convert angiotensin 1 to 2. It's a good enzyme in us. Renin and ACE both are very good. If I have fall in my BP, currently I'm talking with you. Just suppose my BP falls. By any reason it falls. It fluctuates, it is falling. So inside my blood, renin and ACE will come immediately. Kidney will flush the renin and lung will flush the ACE. है ना? And they will ultimately form angiotensin 2 and that will maintain my BP again. Okay. But why ACE is present in the lung? What does it normally do in the lung? When the BP is not falling at that time, in the lungs, ACE do one more job, one more function. It converts bradykinin and substance P into inactive products. In our lungs, human lungs, bradykinin is formed as the constantly as the intermediate metabolite. We do the respiration, na? So bradykinin banta rehta hai. Bradykinin and substrate P are formed in our lung. So God has given the ACE, hai na? So ACE convert them in active form. So if we give ACE inhibitor, just suppose I'm having an old patient who is hypertensive in my clinic. Hai na? Today I got a grandfather who is 80-year-old and he is hypertensive. So the first drug I will give to this person is ACE inhibitor. Hai na? So I will give the ACE inhibitor. If I give the ACE inhibitor, the ACE will be blocked. So angiotensin 2 will not form, 1 will not convert into 2 and 2 is not formed. The BP is maintained again. You got it. But this will also block. No. It is a side effect of ACE inhibitor. So bradykinin is not converted into inactive product. Normally bradykinin converted into. So if you are blocking the ACE, the complete ACE will be blocked. Uska ye function to block hoga. We want to block this function, but we do not want to block this function. But unfortunately, it is also blocking. So bradykinin and substance P will accumulate and that will cause the cough. That will cause the itching. That will cause the edema. So these are the side effects of the ACE inhibitor, which are inevitable. You cannot avoid them if you are giving ACE inhibitor. So whenever we give ACE inhibitor to any patient have chronic cough. हाँ ना, BP का patient है, BP ठीक हो गया लेकिन कफ खांसता रहता है. He is not a smoker, but still he cough because he is on ACE inhibitor, a little bit of cough. Sometimes it is very bothersome and we have to shift the antihypertensive drug. You got my point? Say yes if you got it. So cough, edema and pruritus, itching. These are the three complaints because of bradykinin. है ना? You have to understand it. So we are giving ACE inhibitor. So this is also blocked. We want this conversion to be blocked so that our BP can be maintained. But this conversion is also blocked. We do not want it, but it will lead to side effect. So this is the action, mechanism of action, and this is the side effect. How many of you got it? How many of you got it? Huh? So what are the uses of ACE inhibitor? The most important use is hypertension. Lekin other uses are also there. Hana? The most important use is hypertension. Say yes. So I'm having a mnemonic for you. The mnemonic is home care makes patient definitely strong. This is a mnemonic. H stand for hypertension. It is the first choice in hypertension. Acha, hypertension bhi bata deti hu. Antihypertensive drugs are 4. है ना? A, B, C, D. A, B, C, D. A is ACE inhibitor. B is beta blocker. C is calcium channel blocker. And D is diuretic. You have to start with one of them. है ना? First choice is always ACE inhibitor unless until it is contraindicated. But if it is contraindicated, like in pregnancy, we cannot give ACE inhibitor. है ना? And there are few other contraindications also. If the patient is having allergy, we cannot give it. है ना? So there are few contraindications. If it is not there, look for BCD. है ना? Look for beta blocker, calcium channel blocker or diuretic. So what is the best for the patient? You start with one drug. If the BP is controlled with one drug, continue with one drug. But if BP is not controlled with one, give the combination. We give the combination of A plus B and you give the combination of C plus D. है ना? So we try the different combinations. If it is not covered with 2, we give 3. If it is not covered with 3, we give all 4. If it is not covered, it is malignant hypertension, we give IV. है ना? So this is the protocol. है ना? These are the drugs, antihypertensive drugs. Currently, I'm not teaching you. I have given you an overview. So the one of the drug, first choice drug in hypertension is ACE inhibitor. And you understood the mechanism of action also. C is congestive heart failure. And if the BP is controlled, the congestive heart failure will also be managed. Now, M is MI. In MI also we give myocardial infarction. And P is prophylaxis of MI. Just suppose it is an obese patient, है ना? Physically inactive, diabetic also. So there is high chances the patient will have MI in future. The cholesterol is also raised, है ना? So I can give as a prophylaxis also. So MI and prophylaxis of MI. D is diabetic nephropathy, है ना? And S is scleroderma crisis. So this is the 6th indication where ACE inhibitor is the first choice. Please learn, है ना? This is the uses. And side effect, the mnemonic is captopril. The mnemonic is captopril. C-A-P-T-O-P-R-I-L. Captopril. C for cough. I told you cough is due to bradykinin and substance P accumulation. A is angioneuritic edema. It is also due to bradykinin and substance P accumulation. And I is itch. Itch is also due to that. ये तीन तो due to bradykinin हो गए, है ना? P is proteinuria. The protein is excreted in the urine. T is taste. Taste will change. And teratogenic. Never give it in pregnancy, है ना? O is others, है ना? Fatigue है. P is potassium increased. They increase the potassium in the blood. Hyperkalemia. R is renal impairment. And L is low BP. Sometimes BP will become very low. You are giving to a hypertensive, but if you give the first dose पे BP इतना कम हो जाएगा कि एकदम से चक्कर आएगा. Hyperaction. है ना? So captopril is the mnemonic. And there are 4 contraindications. The mnemonic is PARC. Never give it in pregnancy. Never give it in allergy. R is renal artery stenosis. And K is kalemia. Case calemia. Never give if the potassium is already high, because it also further increase the potassium and the patient can have arrhythmia. Say yes. I am summarizing ACE inhibitor, everyone on the screen. My chapter is done and I will finish the session. Listen, we will solve some questions on that. ACE inhibitors. You have to tell me 5 things. You will tell you. Listen, tell me the classification. How many drugs you know? Classification. Out of them, which are prodrug, which are not prodrug? Classification batao sabse pehle. Then tell me the mechanism of action. What does they do? Then tell me the uses ka mnemonic. Then tell me the adverse effects ka mnemonic. And then tell me the contraindication ka mnemonic. We are done. Back. Chalo. So classification same am all prill. Prill. There are many prill. But 2 of them, captopril and lisinopril, these are not prodrug. Rest all are prodrug. Learn that. Is pe question aata hai na? Looking at the prill, you will identify. So this is the classification. What is mechanism of action? Naam hi hai. ACE inhibitor. They inhibit the enzyme ACE. That is the mechanism of action. But you should know what the ACE is doing. You should know. So you know the story. There is an angiotensinogen present in the blood that get converted into angiotensin 1 and angiotensin 2 when the BP falls. So the first enzyme is required renin. It is given by the kidney, secreted by the kidney. The second is the ACE. The ACE is coming from the blood. So ACE inhibitor is inhibiting the ACE. So basically it inhibits the conversion of angiotensin 1 to 2. That's why ACE, angiotensin converting enzyme, it is inhibited. Once angiotensin 2 is not formed, the BP will control. So this is the mechanism of action, the details you can see here. Uses, I'm having a mnemonic for you. What is the mnemonic? Say the mnemonic. The mnemonic is home care makes patient definitely strong. Say home care makes patient definitely strong. Say the full form. H is hypertension. The main drug, antihypertensive. The first choice antihypertensive out of A, B, C, D is A. C is congestive heart failure. M is MI. P is prophylaxis of MI. D is diabetic nephropathy. And S is scleroderma. Scleroderma crisis, maybe there is hypertension. Okay. Adverse effect, I'm having a mnemonic for you. Again, I'm having a mnemonic. Okay. What is the mnemonic? The mnemonic is captopril. Okay. Say the full form. C is cough. Patient have cough. You know the reason also. ACE does one more function. It converts bradykinin and substance P into inactive product. So if you are inhibiting the ACE, so this conversion is okay, you are stopping. But unfortunately, this will also stop. So bradykinin and substance P accumulation causes cough. It's a PYQ. Angioneuritic edema is also due to bradykinin. And itch is also due to bradykinin. So 3 to ho gaye. Uske alawa proteinuria and potassium. There are 2P. Proteinuria and increased potassium. Increased potassium is very important. T is teratogenic and taste disturbance. O is others. And L is low BP. Okay, chalo. Contraindication, I am having a mnemonic again. PARK. Pregnancy, allergy, renal artery stenosis or single kidney. And K is potassium. Hyperkalemia as a side effect. Now, any question based on that, you will rock. ACE inhibitors. So today I taught you a way to read pharma. Today you got an insight कि भाई pharma पढ़ना कैसे है. I again repeat, convert entire pharma into master charts. हर चैप्टर का एक मास्टर चार्ट बना लो. हर चैप्टर का एक मास्टर चार्ट अंडर द फिक्स्ड हेडिंग्स है ना. द हेडिंग्स में भी द 4-5 वही हेडिंग्स रहेंगी. सबसे पहले इंट्रोडक्शन में ऑल द इंपॉर्टेंट पॉइंट्स. द मेन हेडिंग विल बी मैकेनिज्म ऑफ एक्शन है ना. वन ऑफ द हेडिंग विल बी यूजेस. वन ऑफ द हेडिंग इज साइड इफेक्ट्स. समटाइम्स वी हैव कॉन्ट्राइंडिकेशन, नॉट ऑलवेज है ना. एंड फार्माकोकाइनेटिक्स वेरेवर एप्लीकेबल, नॉट ऑलवेज. So under these fixed headings, convert the entire prototype drugs in cubulated columns and read that. Call them master charts. The way to study pharma is master charts. उससे पहले एक चीज करना है ना. You have to learn all the classifications. So learn classification, learn master chart. Pharma is done. है ना. You get many questions from the pharma. Okay, so I wish I could have more time, but I have to stop because I guess there is another YouTube session on the same YouTube channel, है ना, by other educator. So my time was limited. Thank you so much for being with me. I really enjoyed teaching you. Hopefully same from your side also. Thank you so much. Thank you so much for being with me. Hannah, if you have any doubt, you have any query, you can ask me. Okay. I told you that I am available by this name, MedLife by Dr. Priyanka, on social media platform. MedLife by Dr. Priyanka. You can search me and you can ask your queries related to patho, pharma, PSM, micro. So if you have any query, please do ask. Okay. Thank you so much and wishing you all the best. In the end, I would like to give you an advice that if you all are preparing for whatever exam, maybe most of the students are preparing for FMG, which is going to come in this January. I do not want to see any of you again in the next class. Next class means before the, I mean, after this January. I want all of you to crack your exam this short only. So give your best, give your best. Whatever you can do your best. इतना पढ़ो कि बस आंखें पूरी आंखों में से पानी आ जाए, इतना पढ़ो, है ना. गिव योर बेस्ट. यू शुड हैव अ फीलिंग कि इससे ज्यादा तो पढ़ ही नहीं सकते. इट वॉज बियॉन्ड ह्यूमैनिटी. इससे ज्यादा पढ़ते तो आफ्टर दैट यू आर गोइंग टू क्रैक. टेक माई वर्ड्स, गिव योर बेस्ट शॉट. उसके बाद नहीं भी होगा तो यू विल नॉट हैव रिग्रेट, है ना. एंड इफ यू आर प्रिपेयरिंग फॉर नीट पीजी, यू आर हैविंग द एग्जाम्स इन मार्च, वॉट एवर एग्जाम्स यू आर प्रिपेयरिंग, गिव योर बेस्ट शॉट. दैट इज द ओनली बेस्ट एडवाइस आई कैन गिव. एंड it should be strategic. It should not be कुछ भी पढ़ रहे हैं कहीं भी पढ़ रहे हैं. It should be strategic. It should be strategic. Thank you so much. Okay, so I would like to end this session wishing you all the best. Bye bye. My best wishes are always with you. Once you get selected, don't forget to inform the team, inform all of